we should say.
Okay, all right, that's thank you. All right, good. I think that's all I have.
Okay, thank you, Board
Thank you,
Member
sir.
Buckley. Board Member Brown.
Thank you. Edward, just a couple questions. I know that you have mentioned a few times the Christmas holidays, the New Year's festivities can add to that. Obviously, the crowds that got together to watch the Browns or watch the Buckeyes. When do you anticipate that we'll see the effect of all of that gathering? I know that we've not seen much of it yet.
I think that we're starting to see it. The Monday overnight case count reported to us was just shy of 800 cases. That's a very high reporting number. We had been averaging, I want to say maybe in the 500 range, which is still a very high reporting number, but you can see how that's increased. Yesterday's numbers were around 500, but we know that with how testing goes and how laboratory turnaround time goes, we can anticipate Monday to Tuesday being a low kind of count day. So we're looking at this week very closely.
Thank you. And I know that just like with almost everything COVID related, it's hard to predict what's going to happen. But do you have any sense, given what we're doing with vaccinations, and I know that it's a very small percentage of our population that has actually received vaccine, when do you think we'll begin to see reductions because of vaccinations?
So I think,
and if you don't know time, if you don't know in terms of calendar, at least perhaps in terms of timing relative to administration of vaccine.
Sure. Let me work a little bit backwards. One thing that I always like to hear from Dr. Roberts is what her take is. And so what she has said is, when do I think, the city of Columbus can be relatively back to normal, all aspects of the city of Columbus? And at this point, she's saying Q3 of 2021, when we start to look at how vaccinations are rolling out and what the uptake would be in that regard. Now, as we work backwards, we know that at this moment in time, not unique to Columbus, but many states and many cities are dealing with supply chain issues in terms of receiving vaccination doses. We try to get those out the door as quickly as we can. Our partners at the hospital systems are doing that as well. But if we're being realistic, up until Q3 of 2021, it'll be very easy to say we don't have enough doses to meet the demand in our community. And that's just the reality of it as this production comes online. Is that helpful, Board Member Brown?
Yes, it is. Thank you.
Thank you, Board Member Brown. Dr. Pierce?
Thank you so much. Mr. Johnson, first of all, thank you for your presentation, for breaking down the data in terms of what we're seeing in hospitals, the number of cases that we're seeing. You spoke some about our Celebration 1, our zip code cases, and our opportunity neighborhoods. These terms are important because they get at social determinants of health. And so if you would, please take a couple of moments to explain to our community how social determinants of health affect how COVID-19 affects certain populations. Because I think the underlying issue that many of our community members are vocalizing on Facebook, that they said here at the protest when they came last week, was, if we're in the same county, Columbus City Schools, if you have a charter school who's in our county, if you have a private school that is in our county, how are those schools playing and we are not? So if you could take a moment to speak about the social determinants of health and how they factor into the impact that COVID-19 has on our community, or certain segments of our community, I think that will help a lot of people understand why our superintendent took the approach that she has taken in the past and why she brought you in tonight to speak as well.
Certainly, and thank you for the question, Dr. Pierce. I really appreciate it. Obviously, we think all of the social determinants of health are important, so I don't want to go through all 28 because I think that you guys would give me the wrap it up sign, but I think there are some that are really important to speak to. The first one that we'll talk about is employment, particularly employment for parents or caregivers or guardians of students. If there are certain positions that do not enable you to work from home freely, that don't enable you to create kind of this cordon away from others in the public, it creates a risk factor that you could be in a position to contract and or spread COVID-19 much more easily than others. Another risk factor can be housing. We know that in our Celebrate One neighborhood, there's significantly more multi-generational housing. So it's not simply the parent and the child living in the household, but there could potentially be uncles and aunts, grandparents, and others as well in the household. That creates an additional vector for transmission as we look at that social determinant of health in terms of how it spreads, to where it spreads, and why we see hospitalizations increase in our Celebrate One neighborhoods versus non-Celebrate One neighborhoods in Columbus and throughout Franklin County. And then lastly, we can look at something like transportation as a social determinant of health. When we have to use public transportation, which is a fantastic asset and a fantastic resource, it still creates yet another vector of transmission where there's this risk factor that you're exposing yourself and even the others in your household to, because you're around others for prolonged periods of time. And so looking at those three social determinants of health, where we're trying to say these are very basic things that we know all families, all households need, those are factors that we look at that we say, those are things that we really have to address and Celebrate One neighborhoods. And knowing the reality of how they operate, we're seeing these higher risk factors. And while it's difficult to pinpoint that that's the reason we see higher infection rates, higher hospitalization rates, and higher death rates in Celebrate One neighborhood, we have to take this holistic view and say, are these factors in that present situation we're seeing of the pandemic in those neighborhoods?
Thank you so much for that. I appreciate it. And I hope that helps to provide our community members with more of a context as to why we are looking very deeply into this issue, but also why we are moving at a pace that which some may say is slow, which some may say is very cautious, because we are very mindful of all those determinants. My final question is this: as we think about the fact that COVID-19 will be here, regardless of if there's a vaccine or not, this is a virus that has hit our community that is mutating. Are there discussions in your area in particular to help mitigate, eliminate, decrease those social determinants and those risks that we have in our particular communities that are being hit, again, extremely hard by this?
Certainly, as we look at a lot of these issues, I think that we have to look to what is the proximal goal and what is the distal goal. I think that as we look at an issue like racism as a public health issue, we will examine these issues very deeply, very intensely, and with a lot of data, but those are not solutions that will come necessarily in 2021 to provide an immediate solution. And so when we look at what do we have to address in the immediate term, we have to look at vigilance. We have to look at heeding the guidance from our health experts who may say, listen, right now the best thing is to stay at home. It is advisable to continue wearing your mask. It's advisable to raise your hand, and roll up your sleeve when the vaccine becomes available to you. So in that immediate term, we have to continue using these kind of proven and known mitigation factors in light of what we do know about the social determinants of health in those neighborhoods.
But there are some long-term things that we could be thinking about that will, of course, take coordinated efforts from multiple levels of government, community work, nonprofits coming together to help, again, eliminate those social determinants in our Celebrate One communities, our opportunity neighborhoods.
Yes, ma'am, absolutely.
Okay, those are all my questions. Thank you so much, Mr. Johnson.
Thank you.
Thank you, Dr. Pierce. I believe Board Member Beckerly has one more question.
Actually, I just now have two, but the first one's very quick. I want to make sure that I am correct in my understanding that the guidance from Columbus Public Health is the same as the guidance from Franklin County regarding extracurriculars and sports. Is that accurate?
I'm not aware of what the specific guidance relative to extracurricular activities is from Franklin County Public Health, but I do know that the stay-at-home advisory effective through January 23rd was issued from the Columbus Health Commissioner, Dr. Roberts, and the Franklin County Health Commissioner, Mr. Joe Mazzola. So it's effective for both jurisdictions.
Okay, and then the second question, kind of, Dr. Pierce, got me thinking. And given what we know about the social determinants of health, independent of the coronavirus, which is that the social determinants create greater health issues for certain communities with our Celebrate One communities, for example. Those additional health concerns or health conditions are underlying conditions that make it more serious for many of those residents to contract COVID. Is that correct? Like they're more at risk?
I would say based on the data, we would see higher risk factors in those Celebrate One neighborhoods, particularly when we look at the hospitalization and the death data relative to non-Celebrate One neighborhoods. So that's definitely a great concern there.
And they're fairly significant, right? They're not minor.
No, they are not minor differences.
Thanks, dear.
Thank you.
Board Member Ragland, I think I saw your hand go up.
Thank you, Madam President. My question, Mr. Johnson, again, back to the other areas of the county. So with other areas within our county, essentially avoiding the stay-at-home order of the health commissioner and Franklin County's health commissioner, is it your opinion that that those students and staff members in those areas are at a higher risk due to those actions?
Not being intimately aware of the plans and tactics and mitigation strategies taken in other school districts, I don't know if I'd be qualified to provide an answer to that question specifically.
And so that is, thank you for saying that, because the question becomes whether or not the activities of mitigation in those areas are sufficient enough for the schools to make a decision to move forward with allowing their students to practice and compete, or to practice and perform, because we are talking about extracurricular activities. Would it be your opinion that if mitigation activities are sufficient, that Columbus City Schools could attempt to get back into our extracurricular activities or our athletic activities sooner than the January 23rd date?
I think that Dr. Roberts' guidance and advice to the community to stay home through January 23rd is clear, and individuals should try their best to stay home through January 23rd. I think after that, there can be discussion of what's the appropriate strategies to take to have individuals performing their daily activities that they would like to do after that safely, with the appropriate mitigation strategies in place. But I think the advisory is to stay home through January 23rd, and that's what Columbus Public Health would usually recommend to folks.
My last question, will you stay with us as we hear presentations from staff members regarding our proposed mitigation activities, and then be able to answer questions following the staff's presentation?
Board member, I will certainly stay with you. I can't guarantee that I'll be able to answer the questions, but I'll try my best.
Thank you, sir. I appreciate that. Thank you, Madam.
Thank you, Board Member Ragland. Just a reminder, board members, we do have Dr. Bodie from Children's Hospital, who is also here to help answer questions as well that maybe Edward is unable to, that's more directed at pediatric care of children. So we're going to go to Board Member Cole, who has questions.
Thank you, Madam President. Thank you so much, Mr. Johnson, Dr. Bodie, for joining us today. My questions to both of you are twofold. The first is just a point of clarification. What is the color level that the county could comfortably, and I want to use that word as gingerly as possible, because I understand that very tragically lives have been lost during this pandemic. So I want to be very, very sensitive to that point. But what is the level of risk that the county could drop to that would allow the opportunity for institutions like ours, small businesses even, but more specifically school districts, to not only return to class, but also return to extracurricular activities close to the way that we have traditionally celebrated them or taken part in them, whether as athletes or as audience participants?
Certainly. Thank you, Board Member Cole. So the current color level on the Ohio Public Health Advisory System is red, or level 3. To your question, I think that if there are appropriate measures taken, you're certainly able to conduct these extracurricular activities. To the second part of your second question, how to celebrate those activities as we have traditionally done in the past. It has been Dr. Roberts' advice when reviewing plans for athletic events in particular, because of how the state orders are written, that she would like to see 2 consecutive level 1 or yellow declarations on the county system before we celebrate those in these big, open, public ways where there might have to be a variance granted to allow more fans than what's currently allowed under the algorithm provided to us by the state for those types of large gatherings.
Thank you so much for that. So again, 2 consecutive iterations of yellow or lower ratings.
Yes.
As we move forward, to feel any measure of comfort to reconvene activities, you still adhering to CDC guidelines.
And in particular, that level, those 2 consecutive yellow 1 declarations are also relative to spectators, having large amount of spectators within the facilities, whether it's indoor or outdoor.
Okay. Thank you again for that point of clarification. The other question is, are you able to identify those high risk, let's just say zip codes? What are those high risk zip codes that would fall into those categories of high risk for us to consider?
I can certainly provide you with the slides again, but most of them are falling along those Celebrate 1 neighborhoods, and they continue to do so. In recent weeks, we've seen some of the outlying zip codes on the eastern border of Franklin County, and even in the western portions of Franklin County start to shade darker in terms of their rate per 100,000 relative to cases. So we do think that's pretty concerning as well. But it's our priority 1 neighborhoods that give us the greatest concern and heartache when we look at the numbers that we're seeing.
So thank you for that, Mr. Johnson. So does that entail, I'd like to be a little more succinct, if we can. Is that 43205? Is that 43207? Is that 43219? Is that 43232?
So when we look at the rate number, we're starting to say 43229, 231, 19, 01, 10, 15, 28, 23, with a handful of others that are outlying zip codes as well.
Mhm. So just for listening folks, I mean, we're talking from downtown to the west side to areas of the south end to our near east side communities. This is pretty much what we're talking about.
And 43068 as well, I would probably put in there. So far
Wow.
east.
That's far east, yeah. Okay. I thank you so much. Thank you very much.
Thank you, board member.
Thank you. And Eric Brown, one more question for you.
Thank you. Mr. Cole's questions reminded me that I wanted to ask a bit about how does COVID spread throughout the county? And I assume that's applicable anywhere, but how does it spread? I know, at least my understanding is that the virus doesn't recognize zip code borders or county line borders or any of those kinds of things. So what is it that, how do we attribute this location data when the disease is apparently very easily spread?
Well, I think that board member Brown, your question speaks to, we're a high incidence county. The CDC definition is 100 cases per 100,000 of population. Franklin County sits at 630 cases per 100,000 of population. So more than 6x the definition that the CDC provides. This is truly the greatest example of community spread that we could possibly give you. There's nowhere to hide. That's why we're saying you have to stay at home. We have to mitigate risk here. We know that it's person-to-person contact through respiratory droplets. And so that's why we say, even with the vaccine as it's coming online, we still encourage folks to wear their masks, to engage in these mitigation strategies until we've achieved herd immunity, which is 80+% of our population taking up the vaccine. So I hope that helps answer some of your question, board member.
Okay, any other questions?
It does, thank you.
I'm sorry, you're right. Yes, you did tell me, Vice President Reyes, that you had a question. Sorry, your turn.
Thank you. Just one question. So a lot of goes off of what Board Member Ragland was saying when we're trying to look at zip codes, or maybe it was Board Member Cole. Do you have any data, or do we collect any data on, like, I guess you would call high risk activities, right? Or district or schools? Do you say this district, these schools have children in these zip codes do X, Y, Z? Or are we able to take, are you able to aggregate data down to those types of zip codes? If you said these 10 zip codes are places that our students reside or ex-students reside, what are the rates for those zip codes? I'm assuming that that's something that we could pull.
I believe so. I don't think it's something that we've pulled specific to the manner in which you've asked. So I think it's something we can look into with our Office of Epidemiology, Vice President Reyes.
Because I was just wondering, sometimes we talk about if there's an activity, there's something that goes on, like a lot of people talk about, for example, Christmas vacations happened, or people went to and I don't want to pick on it, the Arnold Schwarzenegger event, and because they went there, now all of a sudden we have X number of increase of COVID cases. So I was just wondering if there can be, it's probably not that easy to aggregate data because of so many moving parts due to COVID, but maybe that could be also an indicator. So I appreciate your information.
Thank you. It looks like Dr. Pierce might have one more.
Just one quick comment. I think, Mr. Johnson, if you can disaggregate that data and pull it, that would be great. But I would ask that we temper what we are able to analyze or draw from that data. So let me be more specific. When we look at a district like Dublin, those students are able to take Christmas vacations and could still hop on a plane and go out of this state and visit whomever, do whatever, right? Our students may not necessarily have been able to do that, right? So there's different types of risky behavior, right? And I think when we start to look at what community is engaged in different kinds of risky behavior and what's the level of risk related to those behaviors, it brings us right back to the social determinants. Our communities are engaged in risky behavior because we're the essential workers that are cleaning the hospitals that people are at. We're the essential workers that are driving the buses that are taking students to charter schools and private schools. And my father's a COTA bus driver. They're not on lists to get COVID-19 vaccines, but he's been driving throughout all of this, right? Our family members, our parents, our aunts and uncles that are living in these multi-generational houses are every day facing the risk of this virus. So I would just ask that we be very mindful when we start to compare these risk elements. At the end of the day, our communities, our zip codes are being hit the hardest because, again, we're the essential workers. We tend to lack in healthcare, preventative care. When we do get sick, we might hold off and say, oh, it's just a cold, when it could be something more serious. So we don't have the resources to go pay a copay 3 or 4 times just to find out, oh, you have a cough or you have the flu or you have something more serious like COVID-19. So I just ask that while it's important to look at those risk factors, at the end of the day, it all comes back to those social determinants. And the fact is, we have a racist healthcare system in this society, and COVID-19 has shown it very clearly, and it's affecting this district. It's affecting education.
Thank you, Dr. Pierce. Hold on, Board Member Beckerly, let me ask Dr. Dixon, because I think your question is for Dr. Bodie, and I just want to make sure that aligns with how she was going to lay out her presentation today. Dr. Dixon, is it okay if Dr. Bodie takes health questions now?
Yes, that's appropriate. Yes.
Okay, go ahead, Board Member Beckerly.
Not me. Thanks so much, Dr. Bodie, for being with us. Are you aware of, do you know if there's any data that's suggesting how the schools or the districts that are playing their experience of infection or the rate of infection where they're playing sports?
Yeah, that's a great question. So there is some national data coming out about that. And of course, not every community is the same. And that data is definitely tempered by what is the community rate of COVID at the time that you're doing that. So I think Edward had mentioned this, but risk factors are risky things that you do, or you choose your level of risk for COVID on your family in multiple different ways. So it's not that you have no risks and then one activity. So sports is definitely an activity that does bring with it some level of risk, of course, right? Because you're getting together at a sporting activity. There are mitigating measures that you can do to help reduce that risk level. If you're limiting spectators, athletes are masking, those types of things. But those can be additive. So the challenging thing in our community is that our COVID rate is already so high in the community that when we are seeing rates of COVID infection amongst teens, trying to determine which activity that was put to, whether it's family or friends versus an athletic event, it can be challenging. So we may not have the data to look at whether there was one event or one game. I can tell you, though, as a trend across the nation, we are seeing that some of the spread in teens regarding COVID infection can definitely be linked to sporting activities, so to athletics. So less so with student-to-student transmission in schools, and more with those after school activities, extracurricular activities, where maybe people are a little less vigilant, closer contact, and potentially without masks. So that is something that we do see as a trend, that we do know that's a higher level risk activity than, for example, distanced learning with all those mitigation measures in place, or hybrid learning models.
Thank you. And I get, maybe this is to either you or Edward, and it may be that I just think I want more information than you're capable of generating, but is there any sort of a rule of thumb, like if two people get sick, and then I know there's some factor about how many people will get sick per case, like that gets you to this exponential. Is there something else that there's a way to predict, like if somebody gets sick, how many more people or how many people will end up in the hospital? Like 0.5. Okay.
Yeah, I think it's really hard to put a number to that, because it's going to depend on the characteristics of that exposure and of the people that were exposed, right? So what their health status was to start with. So I think it's really hard to put a final number on that. Edward, I don't know if you have any more specifics, but I haven't seen any numbers.
Oh, yeah. So board member, I think that you're speaking to the replicative rate. So I don't know if we can calculate that for hospitalizations, but the replicative rate is essentially a number that says one infected person will infect X number other people within their community. And it's a tool that can kind of demonstrate level of spread locally. I think ideally you want to see a replicative rate under 1. The last number I think I saw, the replicative rate might have been 1.1 in Franklin County, maybe at the beginning of this month.
Okay, and so then I guess the question, or the thing that keeps going through my head, and I'd like to hear Dr. Bodie and Edward, what you have to say about this, or what your reaction to this is that we're being asked to answer the question, a very valid question on the part of our families and our students and our athletes and our extracurricular people, which is, why are we not able to do it when they're doing it? And the answer, one answer that comes to me is because we're following the guidance. And I believe, I don't think this is wrong to say that some of the other districts in the jurisdiction, in the county anyway, are not. But I think that it's even a little bit of a more difficult question for us to say, well, we're going to follow suit and not follow the guidance either, because of our size. And I keep, well, it's difficult for us to say because we've gone through this whole social determinants of health concern, and the fact that many of our zip codes are being disproportionately affected in terms of hospitalization rates and infection rates. So that's one concern. We're worried about our own community, but also, well, we're worried about, I think, I'm also concerned about, because we're the 900-pound gorilla, as opposed to one district and another, Westerville's pretty large, Southwestern's pretty large, but none of them are as large as us. If we were to decide to do this, would we be the factor that tips the scales in terms of overburdening our hospitals? Like, are we doubly burdened, not only because we have issues regarding social determinants of health and higher infection rates in many of our zip codes, but is it also just because we're so large? Anybody?
So I can start this, and I think you really addressed two issues that I think are pretty important, right? And the first one to take is around the social determinants of health and what is the possible spread in the community, both as it exists already at a higher level, just given the numbers of people live, plus those social determinants of health factors. So is there a potential that additional cases in this community could lead to a higher incidence and burden of significant, illness and even hospitalization and death in that community? And so I do think that's something to consider, that maybe an outlying community with smaller group of people that they're taking a look at might not feel quite as burdened to pay attention to. or they're willing to take on that level of risk because maybe the outcome isn't quite as significant or dire if you're looking at what that could look like. And so it's not only in the total numbers, which is also important in your district. So you are talking about larger numbers of people. And in addition to that, you're talking about people that are at higher risk of developing significant disease. So I think you have both those factors, unfortunately, right? You have your size and the total number of people, plus those additional health factors that you have to consider.
But
So does that make that a black or white decision? And, you know, it just means that this group has to be thoughtful and think through your situation in particular and how you're going to handle all the decisions you're making about both extracurricular activities and in-person learning with the knowledge of what your particular community's you know, risk factors are as they stand right now. And I think you're doing that, which is excellent.
so, I mean, I guess maybe to be more direct about, not direct, but more like, is there any part of you when you're talking to your fellow experts saying, you know, if Columbus were to start doing you know, sports, it could really tip the scale? Like, is it the kind of thing where you're thinking, oh no, or is it just a little too vague? Or maybe we're, even though we're bigger, we're not big enough to really move the epidemiological scales. I don't know.
Yeah, I think it would be really hard to say whether that is true or not, because I think it depends on to what level, you know, athletics are restarting or extracurricular activities, and then what mitigation strategies are being used when you're doing those activities, because that lessens the total risk. So I think it might be overstating if we said that for sure there would be a link to those two things, because there are other factors at play here too, right? With our community level so high already, and some other, you know, factors of people gathering, you know, when at the holiday time that are affecting our numbers. So I don't know that you would say that that in and of itself is going to for sure be something that would tip the scales.
Okay, thank you.
Thank you.
Remember,
Edward, you-
I think to answer, I apologize.
Edward. No, go ahead, Edward, if you want
I
to
think-
answer. Sorry.
To answer your former question, I think when you first got started, I want to say that the answer is that the health commissioner for those areas, in conjunction with the health commissioner that serves Columbus City Schools, issued a stay-at-home order concurrently, and some were privileged to not necessarily follow all aspects of that order.
Dr. Pierce.
Thank you so much. These questions are for Dr. Bodie. Dr. Bodie, thank you so much for your willingness to answer questions. So let's first deal with this issue of size, right? We are the largest district in the state of Ohio. We get it, we acknowledge it, we accept it, and we are proud of it. But when we talk about sports and extracurricular activities, I would venture to say that our sports teams are equal to, if not smaller than, some of the teams that are already playing. So I see you shaking your head to that. So when it comes to size, again, our teams are equal to, if not smaller than, the teams that are currently playing. So the real question that I have is, in essence, this: can you please speak to the readiness of Children's Hospital to handle cases, to handle symptoms once we return back to school and to sports?
Thank you very much for that. So Nationwide Children's is partnering deeply with Columbus City School District and been in multiple meetings, one earlier today, looking at how we can partner from a health perspective as you get back into any and all activities. So whether that's in-person learning, extracurricular activities, all of the above. And what does that mean? That means, you know, really looking at and working with your excellent staff that's already thought about protocols. What do we need to put back in place when we are doing these activities to make them as safe as we can and minimize risk? And then if we are seeing children that are having symptoms, how can we efficiently and effectively help families get what they need? Whether that's a visit to the doctor, a test that can be done either through Nationwide Children's or right at their school, what could that look like? And we're actually working through a process right now to do that. So we are definitely here and available to be your healthcare partner for pediatrics. Now, of course, I will say some of the burden of this is when those kids, if they are having symptoms, are home, right? And then are affecting some of their adults that live in that household. And so this is going to take partnership with our adult healthcare providers as well, as they're already doing, thinking about how we can make sure that these families are getting access to the care that they need. As you mentioned, that they aren't feeling like they need to wait, that they're able to get the care that they need and have that access. So we do want to make sure we're addressing the whole family as well. So all family members, not just the children.
And I appreciate that, because even in your response, it makes me think that should a family decide that their child plays sports and they're taking that risk, then it's upon us collaborating and partnering with you to say, ensure that when that child comes home, they're still wearing the mask, right? And that's helping to lessen the spread within your home. Ensure that you're still wiping off areas very frequently with disinfectant and that you're cleaning. So there's some education that can take place between our district, our health providers, to again ensure that we're protecting the entire family as we ramp up and gear up for, again, and I love how you say not just sports, but returning back to school as well. With February 1st, as our superintendent has stated, is our return date. These are the types of things that we need to be proactively thinking about. And I appreciate the fact that you all are doing that work and being very, very diligent to ensure that you're doing that work proactively ahead of time. Thank you so much.
Thank you. I believe there are no more questions from board members, so I will turn it back to Dr. Dixon.
Thank you, Board President Adair, and thank you, board members, for your questions, and to our guests, Dr. Bodie and Edward Johnson. Again, I think the answers and responses they have given demonstrates why we have been following the health guidelines of Columbus Public Health. Again, I recognize as a leader of this organization that decision has not been popular. But I appreciate you laying the groundwork of the why, that we believe that in order to keep our students and families, our students safe, that we should follow the guidelines. However, we have, looked at if we could do this and do this safely and bring our students back and bring them back safely, knowing the landscape. And that's what we're presenting tonight. If we can mitigate some of those factors, what are those and how can we do that safely? But again, I wanted to make sure I stated the reasons that you have outlined so well. Both of you are experts, and that's why I have you, the experts that are here, to really help, hopefully to help the public understand why we are following the guidance and how we move forward. So at this time, I would like Dr. Betty Hill to begin her presentation on our extracurricular activities. So Dr. Hill, I'll turn it to you now.
Thank you, Dr. Dixon. I'm going to share my screen. Good evening, President Adair, Vice President Reyes, Treasurer Bahorek, Internal Auditor Smith, members of the board, and Superintendent Dr. Dixon. Thank you for this opportunity to share information about arts and related extracurricular activities. Columbus City Schools students and art teachers have been busy this semester of learning, not only producing art in traditional ways, but increasing their knowledge and talent in the digital world. Through traditional arts activities and the use of our newly purchased learning platforms, students are immersed in opportunities that inspire creativity and greater depth of knowledge. To provide some context, many of our extracurricular activities are directly related to the arts. So the preparation for a blended learning environment has been key to the preparation for extracurricular activities related to these arts. As shared in the December Family Engagement and series, students continue to participate and create art in the current environment. It just looks different. Marching band students participated in an abbreviated band season following a plan that observed the health and safety of all students and staff. You will see here in the photo the Centennial Marching Band on the field participating in their much anticipated 2020 fall band season. Our annual music instrument drive brought in more instruments than ever, over 680 musical instruments that we promptly began putting into the hands of our students for learning. Then there was the distribution of thousands of art kits, K through 12 district students that received these art kits for continued art experiences and learning in visual art. Our teachers have increased their learning to showcase student talent digitally. It is amazing to see what our students have learned about their own creativity and capacity in the arts. And shared here, you'll see some digital examples of the unlimited creativity of our students in the digital format. I won't take the time to click on these, but this is what it looks like. And you can click on these examples to see what our students have done in the digital world.
Cool.
Looking forward to opportunities that may exist for students in hybrid blended learning and related after-school activities, the Unified Arts has purchased and sent to each middle school and high school building specialized PPE and supplies to support each program. Specialized instrumental music masks will enable students to play and limit the amount of aerosol particles released into the air. These masks have small slits that move aside in the front, enabling the player to keep the sides of the mouth covered while playing their instrument. Bell covers were purchased to limit the amount of aerosols escaping the bells of instruments while played. In anticipation of the blended learning environment and extracurricular activities, many collaborative meetings and planning sessions with teachers, principals, and other important stakeholders were held. We have responded to many information requests from the community and staff about the safe return of extracurricular activities in the arts. After-school activity plans are in place for multiple programs, including theater, musical theater, show choir, and band. These plans are based on the health and safety protocols of Columbus Public Health and the CDC. Students participate using purchased specialized PPE and following social distancing guidelines. Arts events and performances are scheduled for online streaming without live audiences. Columbus City Schools Media and Technology will assist with making performances available to parents in the community within 24 to 48 hours. Students in the Digital Academy will have the opportunity to participate in 2 11-week arts clubs. There will be an art club and a music club. Virtual activities will be held from 4 to 5 on Monday, Tuesday, and Thursday for students in grades K through 8. Finally, as always, students in the Digital Academy are afforded the opportunity to participate in the extracurricular activities provided by our many community partners, from the Columbus Symphony to Shadowbox, First Tee, Kappa, Opera Columbus, Ballet Met, and many more. These opportunities are shared with teachers and administrators of the Digital Academy to pass along to our students and to their families. So moving forward, our next steps will be to provide teachers with professional development. Professional development is currently scheduled for February 3rd. Teachers will be provided the opportunity to learn the procedures for recording and online streaming of student performances. In addition, meetings will be needed with teachers and principals to discuss the guidelines for the proposed co-curricular activity plans should they be implemented. And finally, determining the impact on custodial services and making the appropriate adjustments will be needed. So in conclusion, I thank you for your time and I welcome any questions you may have.
Thank you so much, Dr. Hill. Are there questions on our co-curricular activities around the arts programs? Board Member Brown?
Yeah, I just want to thank Dr. Hill for a very good presentation, a very helpful presentation, and providing better understanding of what's happening with the co-curricular activities that we have other than sports. So thank you.
Thank you. We have Dr. Pierce, then Board Member Ragland.
Dr. Hill, thank you so much for this presentation. And I'm not sure if we had the opportunity to thank you during our fall sports season. I had the great honor and opportunity to attend, I want to say, a football game for every one of our high schools, and to hear our bands play and to see them at the end zone was absolutely phenomenal and great. So thank you for working with our music directors to ensure that our band members had the opportunity to showcase their talent as well. We appreciate that. So I have two questions for you. The one question is really around equity. As we look at that gift of music and we note that, well, you know, we got 680 instruments, what schools, you know, because as I think of Dominion getting, I want to say $100,000 worth of equipment, you know, how much did Champion get? How much did East get? Because I think about our marching tigers, right? What are we going to do to address the equity issue as we come out of just these early stages of adapting to COVID-19? It's again going to be here with us and affect how we do school moving forward. How are we going to deal with that equity issue to ensure that all of our students who have an interest in playing music during this COVID-19 precaution, blended hybrid learning, but even after, are given the opportunity to get an excellent instrument to play and to learn how to play music with?
Thank you, Board Member Dr. Pierce. So we are absolutely committed in the Unified Arts Department to making sure that all of our students have access to an instrument. And we also, we're committed to trying to get as many students into our music programs as possible. So we are committed to that. But on the other side of that, we have a process in place by which we have our band directors submit on a document, a Google document we actually use, the needs for each department, but also we have them submit what they actually have in their department. So we can actually check the department and see where the numbers are, what the data is showing, how many students are in the program, how many students they have in their classes, and what is needed in those classes. And we can then insert instruments into those programs. We can see where the need is and actually take the instruments, put the instruments where they are needed. So we use that process in order to, we use the data in order to inform where the instruments should go.
And see, I asked this question because while we know that sports are very good in terms of helping students socialize, music also has the same benefit. It can help students relax. It can help students learn how to, in some instances, meditate. In some instances, you know, the arts can take you to a different space in which you're able to learn who you are. So even as we talk about sports, we also have to recognize that arts and music has the same impact. So I would love to see us begin to highlight more opportunities for our students to also participate in arts and music as a form of wellness, right? Just overall wellness. My next question relates to the PPEs. I love the fact that we have the covers. I'm happy to see those. My question is, do we have 2 to 3 of those covers for each student? We know that those covers need to be changed often or cleaned regularly. So will the band directors be keeping those covers and washing them for students? Are students responsible to wash them and bring them back every day? What does that look like?
Thank you. So the answer to the first part of your question is yes, the band directors, each school did receive extra. We purchased extra PPE. So they didn't just receive one per student, they received extra for each building. We also have extra on hand in the Unified Arts office to send out. We didn't send it all out at once. However, the answer to the next part of your question about who's responsible for cleaning the PPE, and they are available. They have the opportunity to be washed. It is PPE that is not disposable. It is you are able to wash it. So the bell covers for the band instruments, they are polyester, which is the recommended material for the PPE. Those covers can be washed. They will go onto the instruments. We recommend that they stay with the particular instruments. Students, we recommend take the instruments back and forth with them. We know the students may lose them, which is why we have extra. We do recommend that the students' instrument clean those bell covers, which may lead to students losing them. We hope not, but that is an actual fact. It could happen. As far as the masks for instrumental music students, the masks that cover the face and with the slits, those specialized masks, we recommend that the students keep those in their cases and carry them back and forth. They use them for the middle school and high school students that are using those instrumental music masks. They do not use those masks in their regular classrooms. They only use them in the instrumental music classes. Take them off, put them in the case, and use a regular mask during the day. But that mask should go with their instrumental music instrument and carry it back and forth. It is to be cleaned also by the student, not by the teacher.
Excellent. Thank you so much. And then my last question relates to our performances. So I'm super excited to hear that when we do get back into our buildings and get our programs going again, we will have the opportunity to see some of those great theater performances, and that you said that they'll be available 24 to 48 hours. As we look at, there's no, in the past, there have been some programs that are able to provide online ticket options. Some of our programs have been cash only. Will we, as a extra or co-curricular department, ensure that all of our activities move to an online ticket purchase system for families and community members? Understanding that in some instances, you all might have to regulate the selling of those tickets. So some families may be allotted a certain number of tickets. Community members, it might be the first 50 and then we're sold out for community. Is that something that we're thinking about, ensuring that there's online purchasing systems for everything?
I think that number one, that is an excellent question. And I do not have the answer for that at this moment, but I will definitely get the answers for that. We have the ability to do that. Some of our buildings do it, some of our buildings do not. But I think that is an excellent, I think that we should. So I will look into it right away.
Thank you. And I see our treasurer just jumped on board if you wanted to add something.
I would totally agree. We do have online capabilities for ticket sales and collections. And we can work with Dr. Hill at her convenience to get whatever we need set up. So we can do this.
Thank you.
Thank you. I appreciate that. And I just think our families will appreciate it as well, that cashless system. Again, noting that in some instances, some families may not have access to a debit card or a credit card. So we still need to accept cash, right? But if we can make online purchasing available, that would be great.
Dr. Pierce, even in the online system, not only I'm about 99% confident that in addition to credit card payments, debit card payments, we can look into doing ACH payments, which is where you actually debit your checking account. It's like an online check, so it's as close to cash as we can get. But we'll certainly. Dr. Hill, you probably know already who in my office to contact for that.
Yes, I do.
She's extremely proficient at this mechanism, so we can get her done.
Awesome.
I guess is that the way to say it.
Thank you.
Thank you. I appreciate it. That was all. Those were all my questions.
Thank you, Dr. Pierce. Up next is Board Member Ragland.
Thank you, Madam President. Thank you, Dr. Hill, for a great presentation. Well, it's not a concern, it's actually a question. Was consideration given to competitive, competitions for music in the spring? Ohio Music Educators Association and some of those other opportunities that really propel our artistic students into scholarship opportunities and other things. Was consideration given to, registration times? And I guess it is a concern that we are limiting, I guess, the size of ensembles that can participate or how are we addressing, if you had a show choir of 20 students, but you can only have, a handful now, what happens to the other, say you cut it in half, what happens to the other 10 students in that opportunity for them? Have you thought about those types of things, and are our students prepared to have a good shot at going into this spring competition season for our arts activities and show the level of excellence that we've always shown as a district?
Thank you for your question, Board Member Ragland. So what I would like to say, there are two parts to that question. Number one, in terms of the size of our groups, we are most definitely not limiting the size of our groups. The group size is only limited in terms of theater. So according to the plans, we are asking for the theater groups to exercise the opportunities for small theater ensembles. So for instance, instead of doing large theater productions, try to look for those smaller theater productions, smaller theater productions that would involve bringing in smaller groups to work on plays or reviews or programs that would involve smaller rehearsals. So you would have students in spaces that would not be have large groups of students working together, so they could social distance and we wouldn't have large groups. So those would be smaller productions rather than these. Sometimes you have 30 and 40 cast members. We're trying to avoid that. As far as our bands and those types of things, we are not limiting our band members. What we would need to do, therefore, though, would be to separate the rehearsals. Okay, so we would just have to socially distance it. We're not making our bands smaller. That I wanted to make sure I clarify that. We want all of our students to have the opportunity to be a part of a group. We just can't put them all together in an enclosed space. We need to observe the safety and health guidelines set forth by CDC. So that's one clarifying point. The other piece is that for competition, that's been taken care of for us. Currently, competitions, unless there has been a change, and I have to keep up with these things, they change on a regular basis. Competitions right now are virtual. So we just have to keep looking as things are very fluid. And at the moment, OMEA, those types of things, they're all in a virtual representation. So if we move forward with our blended plan or our face-to-face plan, students will have the opportunity to rehearse in small groups in wide open spaces so that they can prepare for solo and ensemble. But right now, solo and ensemble is not happening, sorry. But they would have the opportunity to rehearse together, to prepare for competition, and then to also prepare for opportunities that will move them toward college, to be college ready, because we do want our students also, just like athletics, to be ready to earn college scholarships, to be ready to move on for, you know, opportunities that will get them scholarships to move on to the college situation. So that's where we are with both of those things. I hope I've answered that question.
Yes, ma'am, you have, and I appreciate that. I think my next question is really to Dr. Dixon and her communications team, and maybe our other outreach partners. One of the things we may want to consider is using our social media platforms to broadcast or live stream some of these performances from our students, understanding that you know, we have a lot of folks that would like to participate, you know, that could use some sense of normalcy in this COVID environment. And it would be good to see our young people doing what they do best. We've you know, gotten through some Facebook challenges on our own today, but our YouTube platform was up and running the entire time. I would think that not just for our extracurriculars, like, you know, like our arts and those types of things, but athletics as well might be an opportunity to reach out broader to the greater community with some of the wonderful things that we're doing. Could we consider, you know, live streaming performances within our theater programs, our show choir competitions, those types of things? Could we consider live streaming athletic contests or wrestling meets or things of that nature, so that the public can be a part of what it is that we're doing?
Thank you, Board Member Ragland. And I am going to go to Mr. Wortman to kind of tell us what we've done in the past and what we have the abilities to do moving forward. But certainly that would be a wonderful opportunity to be able to provide that for our families. So Mr. Wortman, if you could could respond to that, please.
Yes, thank you. So to Board Member Ragland's question, yes, that's something that we now have the capability to do. As you know, we live streamed both the City League Football Championship and the City League Volleyball Championship in the fall, and it was just a great product. And all the credit to Paul Brown in our Multimedia Services office. So we've got the team to do it, and it really holds some possibilities of what we could do, not only for athletics, but also, as you mentioned, for unified arts. You know, there's a lot of stuff that, even if we may not be able to live stream it, there are opportunities to capture it, record it, and then publish it in the different outlets we have. You know, because you mentioned YouTube, Facebook, not only our website, but we are talking to the City of Columbus and in a partnership with our Educable channel to really amplify the different outlets we have to publish those types of videos.
Thank you, sir.
Thank you, Board Member Ragland. We will go to Vice President Reyes.
Thank you. Hi, Dr. Hill. I miss our band competition this year. I know how important that band competition is, and it also does fundraisings to for the arts, in specifically the music program, as Dr. Pierce was mentioning, whether we have enough instruments or not. That is one of the tools that we utilize, not only to showcase our bands and our students, but also as a fundraising mechanism. Do we see that possibly happening in this virtual environment? Is that something that you all are looking into possibly doing again?
So it's so unfortunate. we typically have 700 band and drill team students participating throughout the season, 700 students. And we had a fraction of our students participating this year. So, and I know our students really want to participate. And not only that, you know, throughout the year, you know, we have 15 to 20 large events, and we've had none this year. So I feel for the students. I understand when they're, you know, the teachers and the students are reaching out, and, you know, my heart goes out to them because, you know, I'm an artist also, and we live for that. So my heart feels for them. And I want to do it also. And I want to find the best way that we can do it for all the safety of all. Can we do it in the future? Can we do it now? Right now, my heart also wants everyone to be safe. So I'm looking for the best ways that we can do this. You know, I'm exploring those options. So right now, of course, we're past the marching band season. And we're looking now at our theater programs because we're in the theater, we're in the musical theater season. This is a huge musical theater season. So I'm trying to find ways for our theater people to be able to have their programs. And I'm trying to find ways for our show choir people to have their programs and to do it safely. So that's what I'm looking at very carefully. And moving forward, if we're still in this situation later, I hope not. I will try to have a very solid plan that will help us to get back to some of those larger district programs, but it will all be with the safety of students and all of our staff and spectators in mind. It has to be that way.
Thank you, Dr. Hill. And, you know, being involved with CAP and understanding the restraints that are going on with them from a Broadway series and a theater series, and keeping the social distance, and how do you, you know, perform. I've heard them talk about even actors being social distance while they're out on the theater, which kind of throws off the performance a little bit, but it is something that that Broadway's looking at and the CAP is looking at it, understanding that they have maybe bigger platforms to perform. Just the other night, I saw my high school band director play with his symphonic ensemble, probably about 20 to 20, maybe 30 members. And I saw them social distance wearing the mask, but what I also saw was some dividers between the some of the instruments that maybe couldn't be as far. As you're looking and exploring that, you know, this COVID is going to be around for a little bit. I would encourage us to maybe look at what would that cost, right? So we're thinking about what do instruments cost, what do PPE cost, but then some of these dividers and some of these additional tools that theaters and musical and arts programs are utilizing to ensure that the music continues, that the show continues. I just thought it was very interesting and I wish I could direct you to the website, but they actually said it's a live event and it's not going to be posted again. But they did a really good job of West Side Story. But they actually had physical dividers between each of the, some of the instruments that have to be listed a little bit closer together, not necessarily the strings, but some of those sections. And I was curious if something like that would allow us to then bring our kids back. So they utilize the bigger venue. So obviously we know some of our schools have higher ceilings, larger stages, or maybe a gym where we can spread out our students. I mean, and I know it's, I'm sure that Centennial and Whetstone and some of those schools that have larger student populations in the music program, and then most of them have larger facilities, but utilizing some of those best practices or new innovations might be something that could get us up and running. I'm sure you're looking at it, but I just was wondering if you're looking at some of that for, I know that it's high level, but even for our kids.
So I just want to assure you that I am most definitely following the science and following the research. So the research has definitely shown that sometimes, and I do know exactly what you're speaking of. Some of the research has shown that the dividers may sometimes cause a little more, and Mr. Johnson is going to be able to speak better to this probably than I would, but I am following that research. And Vice President Reyes, I most certainly appreciate your input there. I'm going to look at it more, but I most certainly am following that that science and reading the research. But I have read both sides of this for instrumental music, vocal music, whether or not you use the dividers or whether or not you use the mask. So I assure you, I will continue to read that.
I'm sure I appreciate and thank you for our advocacy for our programs. Thank you.
Thank you so much, Dr. Hill. I believe those were all of the questions for you. Again, thank you so much for all the work you've done and for providing the information for the plan, to come back and allow our Unified Arts students to participate in the extent that we can in COVID. Dr. Dixon?
Thank you. And thank you, Dr. Hill, again, for a wonderful presentation. We know so many students are involved in the arts, really appreciate the arts. So I echo the sentiments of the board members. It is a way for students to relax and just kind of, just be in another world, another space through the arts, and really appreciate the value that our district and the students that perform. I think Mr. Ragland received a scholarship in music, right, Mr. Ragland? Yeah, so I mean, we just appreciate what the arts brings to so many different students who there are sometimes those silent students with beautiful voices, or it's just amazing when our students get on the stage and how they perform. And sometimes it's a very different student that you see walking down the hall, right? So the arts sometimes make students really come alive, and we see musicians and all of that. So I'm just so thankful that Columbus City School has an appreciation for the arts, and that it is, ultimately a guardrail for the board, right? It's something that we want to protect and make sure that our students have access to. But we, as you stated, Dr. Hill, that when we provide these opportunities for our students during a global pandemic, we do it very safely, and we make sure that we're following the guidance. And so I really appreciate that, how you outlined your presentation for us tonight. So next up, we have Dr. Vincent Clarino, who is the Director of Athletics. So Dr. Clarino, you're up next.
Hey, good evening, everyone. Members of the board, nice to see all of you again. Dr. Bodie and Mr. Johnson, thank you both for your informational words that you shared with us earlier this evening. And of course, Dr. Hill, you've done a wonderful job just now presenting. I too will tip my hat. I have some artists in me as well. So when she says I'm also an artist, well, I'm also an artist, Dr. Hill. I like to do what I can or what I think I can. I don't think anybody would be impressed with my art, but I'm an artist all the same. So I take it at this time, Scott, is it okay for me to go ahead and start sharing my screen?
Yes, go ahead.
All righty, thank you. Let me find it here, okay. Okay, there we go. Can anyone see that? I'm not really able to see anyone anymore. If somebody can give me a thumbs up, maybe.
Yes, we can see it. Thank you.
Okay, thank you very much. Thank you. So, obviously, we began last week with some discussions by some members of our public that had some questions pertaining to athletics in general. But to be honest, there have been a number of questions that the Office of Student Activities has fielded over, really going all the way back to March, and to those families in the spring when the governor's office shut down athletics without any of us being able to have these types of discussions, and listening to the seniors that lost seasons in track and baseball and softball, and hearing those parents share just how challenging that was. I understand what it took for us to then, as we began to round the corner and getting to fall sports and then obviously now winter sports, those voices and those questions and comments still kind of live with me. One of the things that I will begin with here is to really talk about like the seasonal and game day procedures. I'm not going to read to you completely. So what I will do is summarize a number of our slides because there's a lot of information and meat on the bone here. But one of the things that you'll see here is that prior to the suspension, which was also, obviously in line with the stay-at-home advisory, winter sports was up and running for us in Columbus City Schools. And our coaches and our teams and our student athletes were all adhering to the protocols that we had in place. And so we had, a number of teams that participated in activities, which I'll get to in more detail later on. But ultimately for us, what we will do is we will look at whatever restart date is made available to us in playing competition and practice opportunities, accordance with whatever date timeline is presented before us. So what you see here about game day and practice procedures, you're going to hear information that is very much the norm amongst a lot of different athletic bodies right now. The four big ones that jump out time and time again are going to be that, players need to social distance when they are not in the actual sport of competition. Coaches and players are going to have to wear masks when they are participating. I mean, when they are there in the facility. We're going to ask people, obviously, to do that higher level of personal hygiene and continue to wash your hands and do all of those necessary things to make sure that they're not spreading the germs. We're going to sanitize the equipment and we're going to sanitize hard surfaces. So those things are common throughout, right? And so this first slide here speaks to and addresses athletes and coaches, which were the procedures we were following prior to the suspension. The next slide here speaks to spectators and what we would be asking of our spectators, which would be similar to what we asked of spectators in our fall sports. But right now, based on the stay-at-home advisory, based on the things that we are hearing that are being shared, our current recommendation would be to begin winter sports without spectators to allow us that time to really get a good flow for what our competition setup would look like. But in the event and when spectators are allowed to begin to show up to our contest, we have a set of guidelines that we're asking them to follow, which is obviously to conduct the self-assessments or the symptom assessment. We're asking them to stay at home if they're experiencing COVID-19 like symptoms. We're going to set up our gymnasiums to require guests to social distance when they're sitting inside of our venues. They're going to wear face masks. And so we will do all of those things to make sure spectators are helping to mitigate the concerns of COVID. Officials and game workers are going to fall under the same guidelines and requests. Obviously, those are essential individuals when it comes to conducting a competition, right? You need to have the officials on the court. You need to have the individuals running the game clock and doing the books and those things to help make the game official. And those individuals will follow those same guidelines. The safety protocols that we talk about, and some of this is somewhat repetitive, but a number of the things that you will see here that are a little bit different are the COVID-19 waivers that our student athletes will sign. And that gives our parents information so they understand the situation that their child is partaking in. You'll see also what is somewhat different here is that we're going to continue to obviously to ask the coaches, the players, and everyone to continue to wash their hands, or we're going to use the hand sanitizer prior to or during events. And so when you're going in and out in the flow of competition and those things, you have those safety protocols that you're going to continue to follow. This is that information continued. Our schools right now are set up where we have, in close proximity to our gymnasiums or whatever athletic space is being used at the time. We have disinfectant spray bottles that were provided to us through our custodial department, and they keep those things refilled. So it allows coaches to sanitize equipment and sanitize hard surfaces. And that is just an added layer on top of what our custodial staff is already doing to disinfect the spaces and that our students are using. We're going to encourage that students, obviously, do their part with their personal hygiene, but also to make sure that they wash those clothes. If you don't know much about a teenage boy can wear the same sweaty shirt for days in a row, right? And they don't mind doing that. I got a teenage boy. And so sometimes, you know, even though you're sharing that information with those young people, it's important to have another voice, parental guidance or an adult guidance to continue to kind of hit that home. We also talk about, obviously, we're not going to allow students to share water bottles and things of that nature, because obviously that is a part of how, you know, a virus like this is spread. So we use these safety protocols to make sure that we're participating in a fashion that will help lower a spread to something to this nature. So then we have some site-specific information for our venues. I won't dig real deep into each one of them. A lot of it is repetitive, but it speaks to, you know, not using the locker rooms. It speaks to, for our public at home, and I know a lot of people on the line have heard this, but it speaks to the gym doors being propped open so that there's a decrease in the hard surfaces that are being touched. Once again, you know, coaches wearing face masks are all practices that our coaches exhibited throughout the fall season and that our winter coaches were participating in at the beginning of the winter season. And so what you'll see here on the next slide, for those of you that are able to view here, I'm kind of using my cursor, but this is a setup that was used in our gymnasiums during the volleyball season. And what you see on that far section over there on the opposite side of this gymnasium is how the student seating was set up, right? And so as a, you know, normally when you would go to a contest, those seats would all be in a row all the way across, but to have the students who are not participating at the time spread out and 6 feet apart, the gymnasiums are set up like that for both teams. So that one side of the bleachers are pushed in so that students are not sitting on top of each other while they're not in the game of participation. Weight rooms, the big piece here that stands out for weight rooms is that when coaches are assigning time for students to be inside of weight rooms, what we ask each coach to do is go in and look at the number of stations that are available inside of a weight room. So how many bench presses, how many cardio bikes and things to that nature. And then only having half of the number of students inside that space based on the total number of stations, which helps support the social distancing while they're in weight rooms, preparing themselves for the season or staying conditioned for the season. Bowling alleys is a little bit different. It's a winter sport. And bowling alleys obviously are, you know, a sport that takes place in venues that we do not control. So one of the things that athletic directors done and coaches, you know, participated in before our suspension is that they went out to their home bowling alley, and we call them home bowling alleys, but they went out to the site where they would conduct their majority of their practices. And they had conversations with the management team. They did a walkthrough of the facility. They found out what the do's and don'ts were in that particular facility. And then my staff also, we done that here from a district office. We went out and visited several of the bowling alleys as well. And one of the big things that I will share with everyone who hasn't maybe had an opportunity to go out, if that's an entertainment pastime of yours, one of the big differences that you'll notice if you go into bowling alleys right now is before you used to be able to go over to what they call like the ball tree, where you could pick up your own bowling ball and you go out there and you're rolling away. And then after you roll a couple gutters in a row, you go, nope, this isn't the ball I want. Let me go get a different one. And you go back in, replace it, and you grab another one because you got to blame it on something, right? If you don't get a couple of strikes. And so what bowling alleys have changed is that once you kind of pick that ball up off of that ball tree, they're asking you to put the balls like either in a cart or a certain location so that another guest doesn't use that same ball before it gets disinfected. So they have staff that are picking up bowling balls out of these. A lot of them have like wheelbarrow wagons, and they're taking them to the back and they're spraying them down and disinfecting them. And so that is the biggest change, where you can't put a ball back on a ball tree that another guest could potentially use. And so that's the biggest difference that our bowling alleys have shown, along with them spreading out guests and people who are using the bowling alleys when they're there at their sites. The wrestling rooms, a lot of what you already have heard is what is in line for the wrestling rooms, doors propped open, disinfecting our mats, coaches and wrestlers when they're not in participation to wear their face mask. Our wrestling rooms are kind of located in many different places throughout our schools. And so at the local level, coaches and ADs and principals and custodians kind of have banded together and said, okay, well, where's the space at? And then obviously they go into those spaces, they make sure that they spray them down, they clean the mats, and they do those things before and after practice to help mitigate, obviously, the common thread that we're talking about, which is the spread of COVID. The last space that we're going to speak to is swimming pools. And swimming pools are another one of those spaces that is not a venue in which we control solely on our own. Columbus City schools that have swimming teams primarily use the Columbus Recreation and Parks Aquatic Center, and they also use some of the YMCA venues that are in and around Central Ohio that have swimming pools. So I share before the suspension occurred, we had a number of our schools that were at the Aquatic Center for Columbus Recreations and Parks. They were using that space, and they've been longtime users of that space. But my staff went out and had a meeting with the management team that runs those spaces, and we saw the setup. Even though we've been inside of the pool or the venue multiple times in the past, it was good to see the steps in the direction that they have taken to be able to allow swimming to take place in a safe manner. Now, the Columbus Aquatic Center right now, also in line with the stay-at-home advisory, I believe right now is shut down. Some of the YMCA spaces are open, but obviously with us not in participation right now, we're not using those spaces. The next piece here addresses transportation during for our athletic teams. So for transportation, what you see here first is that we're asking coaches to arrive 30 to 45 minutes before a departure would take place so that they can receive student athletes appropriately and be that guiding voice of direction for ultimately how students should behave and get on the bus and get off of the bus and all of those sorts of things. Student athletes would align outside of the bus. They would social distance. They would use their hand sanitizer prior to loading the bus. And then coaches would obviously have the COVID form that they would have students filling out for that particular day. And those forms are processed and turned in to athletic directors upon departure for athletic events. When you arrive at the event, one of the big differences now is that, in the past, obviously teams could just hop off the bus and go into the building. What a lot of schools are asking is that prior to just getting off the bus and going into the specific venue that they're going to participate in, they have to wait to be checked in. And so whether you're going to another school or whether you're going to a non-school venue, you really need to wait to almost be invited into the space and make sure that the venue is ready to accept you and they're prepared for your visit that particular day. Post-competition and reloading is the same thing. And then this is now what you're going to see are the winter sports, the primary winter sports, and a timeline for each of what for this potential restart would be the January 24th date. And so what you see here for girls basketball is the first one. These are sort of in date order. They're not in alphabetical order. So they're in the order of which kind of like the season began. So prior to the winter sports season suspension, Columbus City schools collectively have participated in over 200 practices and competed in over a dozen scrimmages before the date of this suspension. So our kids were able, they were out there, they were following the protocols, our coaches were following the protocols. We were participating in scrimmages, not only with CCS schools, but we were also able to participate with scrimmages with other schools. So we were actively out there engaged and getting it in. One of the things that also my office tried to do and attempt to do with our coaches is we held multiple meetings for coaches to be able to express some of their thoughts and concerns. I kind of learned here within the last week or so that there was a particular coach, and I'm a person who's big on words. So even though you see the dates there for the multiple meetings that were held with coaches, I had a coach say to me this past week, which I welcomed this, they said, I never used the word recommendation. And so even though I had said to coaches, share with me your concerns, your challenges, share with me your thoughts, they said, I never shared what are your recommendations. So they said they never gave any recommendations. And so, like I said, I'm big on words, but we've met multiple times, and coaches have been able to express their concerns with us. Those meetings you see there are dates that we held meetings virtually for girls basketball coaches. Boys basketball coaches, prior to this suspension of winter sports season for our school district, had participated in over 150 practices and competed in over a dozen scrimmages. We met with them also. There's a list of dates where we met with boys basketball coaches. What I will kind of do is just use one sport to go through like a timeline. This will be the sport that I will speak to, because this is the sport where in girls basketball, the season was to begin before the suspension for Columbus City Schools. In this model, what you see here is that coaching began for boys basketball on October the 30th. The suspension went into effect on November the 21st. So their season was set to begin on 11/25. That would have been the first date by Ohio High School Athletic Association that boys basketball teams could have conducted an official game. The potential restart would begin on January the 24th, based on just the current stay-at-home advisory and the current suspension, winter sports suspension dates. League play would begin on February the 1st. That would provide our team some time to practice and get prepared. And then what you see also is that the OSHA tournament begins on the week of February the 22nd for boys basketball. Boys and girls bowling is listed here next. And I won't go through the timeline again completely, but what it shows is that coaching began on October the 30th. Their season was set to begin on November the 30th. And then obviously you see here the information about the restart, when league play would begin, and when the OSHA tournament is set to begin based on the current dates. Boys and girls swimming, coaching began on the 30th. Season was going to begin on November the 30th. You see the rest of the dates there as they fall in line for the options for boys and girls swimming. Wrestling is one of the more challenging ones, because wrestling is one of those sports where young people need just really a larger amount of time, or more time. I said larger because that speaks to size. They need more time to really be able to prepare to really get in shape for a wrestling season. And so before the suspension occurred, our teams have participated in roughly 20 practices. We met with wrestling coaches on multiple dates. They shared their concerns. Their season was set to begin on December the 3rd. And so if we have a restart on January 24th, league play would begin on the 8th, but it would be really backing right into the OSHA tournament and when those young people would be prepared. So what you see there, right, is kind of a big snapshot of the protocols in place, the timelines for different seasons and different sports. I know there's probably going to be a number of questions, and so I will stop my screen at this time. And I don't know how the questions get alerted, but I will be ready to rock and roll as those questions present themselves.
Okay, I will alert you to who has the questions, and it looks like Board Member Brown will start.
Thank you. Thank you. First question for me that comes to mind, and it's really based on my own personal experience and that of my brothers and lots more family. Spaces, especially in some of our legacy schools, but in most of our schools, I'd say, weight rooms and wrestling training rooms are particularly tight and rarely well ventilated. What are you doing or have you done to provide for those kinds of activities that have been in less well ventilated places to improve?
So Board Member Brown, if I'm understanding your question correctly, I think what you're saying is that some of the weight rooms that you recall or wrestling rooms that you recall, that those spaces may not be well ventilated. Is that the question?
That's the question. Often they're interior spaces without windows, and wrestling training rooms the same. And I saw those, not very recently, but well, actually, my grandsons were working out, so I saw some even recently. But as a referee, as a wrestler in high school and college, that was my experience.
Certainly. So some of our schools, Board Member Brown, where the wrestling room space, maybe as you put it, doesn't have the ventilation that would be as adequate as maybe some of the other spaces in the building. They've moved the wrestling mats into larger spaces in the building to have it in a more open air space. A lot of the wrestling teams also participate wrestling in the gymnasium. So after the basketball team goes, they roll out the wrestling mats and they have wrestling in the gymnasium, which is, obviously a larger space that has a better level of ventilation in our school district.
And that's for practices as well?
Mm-hmm. Yes. Yeah, not every one of our schools has a dedicated wrestling room or wrestling space.
All right, thank you.
Thank you, Board Member Brown. Up next is Vice President Reyes.
Thank you. Thank you, Dr. Clarino. I had a couple of questions. I want to try to see, you went rather quickly through your slides. So I want to, hopefully I'm not going to ask a question that you kind of already answered. But I want to start with kind of about the protocols and processes in total. When you looked at creating your protocols and processes for athletics, did you tailor any of your protocols after maybe some of the NCAA sports protocols, such as how do we handle emergency care kits? How do we handle injuries? How do you handle the exchange of PPE for all games and practices? Are there any? Now stop there. So that's one of my questions. Is how do we compare, or how do we look at some of the best practice protocols for? Because there's a lot that goes into a game. It's not just about showing up and playing with PPE, but it's you sweat if you get sick. If you we have people that wipe down the floors so athletes don't fall. So you gave us a list of some protocols, but do your protocols go more in depth than some of the other things that go into having a game or a competition?
They certainly go more in depth. Thank you for the question, Vice President Reyes. One of the things that we are fortunate here in Columbus City Schools is that our athletic trainers are provided by OSU Sports Medicine. That's where our partnership is with. And so our trainers are individuals who also prepare and provide that skill set for college athletes. Ohio State, obviously being one of the biggest athletic programs in the country, they're training, and I speak highly of what our athletic trainers bring to the table. So yes, they understand how to approach athletes. They understand how to address conditions during these times. And yes, also we have looked at NCAA protocols and looked at the things that that they're doing to be able to provide athletics. The reality for all of us, Board Member, Vice President Reyes, is that if you're going to bring people together, yes, there are those challenges that present themselves, as Mr. Johnson shared earlier in his presentation, right? When you bring people together in large gatherings, that occurs. Even with all of the NCAA's protocols in place, right? Teams have had to postpone and cancel, and I mean that goes on daily, right? If you pull up right now, you're kind of your ESPN list, right? You pull up your ESPN list of games tonight, you're going to see a lot of cancellations and postponements, right? And so that is part of it. And so what I think is important, though, is that we look at all of those in-depth things to make sure that we can provide the best opportunity for kids and young people. But we have looked at their series of protocols that they have in place. I'll share this also. So one of the things on top of that I do here in this office is I meet bi-weekly with the other, I know some people call them the Big Eight, but for the group that we have, it is the six of us with Cleveland, Cincinnati, Dayton, Toledo, and Akron. And so my counterparts in those school districts, we just had a meeting last Friday. I'll slow down a little bit. Somebody's texting me and telling me to slow down. So I'll slow down a little bit. I apologize.
Great.
Yeah. Oh, no, I'm fine. I'm just, I get so passionate sometimes about this. So this is how I'll pause. I'll take a drink of water.
There you go.
But we meet bi-weekly. We met this last Friday. We share practices, we share challenges, we speak to what is working well in their school districts, obviously, and what is working well in our school district. And really, we didn't used to meet as much as we do now. However, during the last 8 months, it has brought about a need for more communication amongst our groups, and it has been tremendously helpful. So speaking to Akron and speaking to Dayton and speaking to Cincinnati, that, so we look at, information where any place we can get it, along with, and I'll share guidance from the Columbus Public Health Department. So they put out a series of information early on at the beginning of the summer and said, hey, school districts, these are the guidelines that we're looking for when you go to roll out opportunities in your stadiums and inside your gymnasiums. And we looked at that extremely seriously and went through and tried to make sure that we were following that direction as well. And so, yes, we do tap into many resources to make sure that we're following, the best methods that are out there.
And Dr. Quino, is there another location or another website or somewhere where you can share those protocols? For example, some of the questions that I heard from the community were, what is the cleaning process between games and practices, especially for those high trafficked areas, so they can be properly disinfected? And if they're highly trafficked, will there be a need to limit access to the gyms or locker rooms so that every day or after every practice will be allowed for cleaning? And does that interrupt the game schedule?
Right. So there was maybe a couple of questions involved in there, I think, Vice President Reyes.
Yes.
So I can work with and will work with Mr. Scott Wortman to get this information on the district's athletic webpage on the district website. The next piece that you talked about, where from a locker room standpoint, right now locker rooms are recommended to not be used. So during that practice time period, young people are being asked to show up prepared to participate, is the term that we use, so that you don't have to go into locker rooms and congregate together. Show up prepared to participate. Locker rooms are being made available in those schools where they also serve as the team's restroom, right? So that you can go in and use it from a restroom standpoint, but we're not using locker rooms in the traditional sense.
Perfect. So this kind of aligns also a little bit by what Board Member Brown was saying. So some buildings have larger gyms. You have already answered the locker room question, but some gyms have higher ceilings. Are we looking, or are we considering, if we go forward, sorry, I almost said when we go forward, if we go forward, that there may be some schools that might be better for us to use because they have some of the, space and can adhere to some of the protocols maybe a little bit better than some of the smaller venues?
So ultimately, right, when you look at our gymnasium spaces, I think what I'll go back to something that I shared, I should say. Initially with spectators, the recommendation would be that spectators are not currently at our contest when we return. That will give all of our schools logistically an opportunity to really figure out some of the ins and outs as we bring in student athletes and teams to have these particular competitions and then move into that type of scenario. But when it comes to gymnasiums, because we are not opening up both sides of any of our schools' gymnasiums, that piece really is almost, I don't want to say it's equal across the board, because obviously we know that some gymnasiums are larger than others, right? But that piece of allowing student athletes to have a dedicated space on one side of the gym really helps equalize some of those concerns, whether your gym holds 1,600 people or 2,000 people, that helps equalize some of that.
Perfect. One of the questions I received, it was, what are the protections for students and staff if there is a case, right? What is the contact tracing? How do we ensure that, we started the conversation off with, I think it's difficult. I work in the nonprofit area where people just have a desire to work, or they have a desire to play. And we may have a little bit of a runny nose, or as we're looking at those protocols, how are we ensuring that we're protecting not only our students, but also our coaches? I know that there's some there are some coaches that are very excited to get back, and we're so excited for them. But there are some coaches that are worried because they do fall under those underlying conditions. And as of today, we heard from Dr. Roberts that there's a little bit of a slowdown possible for some of our vaccinations. So how do we, how are we going to be handling that?
Right. So that's a good question. Ultimately, if you have a student athlete and or a coach, so let's start with, I almost like create two scenarios. One would be the scenario of the student athlete that begins to say he or she is sick while at practice, right? So let's start there. If he or she says I'm sick while they're actually there physically at a practice or a game taking place, the first step is to immediately remove them from the rest of the group. So let's isolate that young person so that the possibility of them getting other individuals sick, whether they have the common cold or, you know, a stomach problem, right? We still want to remove them, so because there's still other viruses out there, right? I think that's one of the things that also gets missed is that, you know, you can still get sick from other things, that we don't want somebody passing a stomach flu or something like that, right? So we isolate those young people immediately. In the event where a young person reports to a coach, let's say if there was a practice today on a Tuesday, and then the next day, young person calls coach and says, hey coach, I'm feeling sick, I'm not going to come in today. Were you feeling sick last night when you left practice? Yes, he or she reports that. So then now the coach works with the athletic director and the school nurse, and they begin to go through what was the contacts that that young person had, and then a decision is made as to whether or not that team needs to shut down so that we can quarantine the individual, so that they, you know, there's not a possibility of I shouldn't say not a possibility, but to help reduce the possibility of spreading amongst team member to team member. So those would be the two big differences. But when a young person is sick at practice or at a game, we remove them. We call obviously the parental guidance and get someone there to help pick that child up. And then we look at what situations or what contacts they had that particular evening. And also what really is within the last 48 hours is what it is.
And I appreciate that, because I know what I think a lot of people are concerned, especially students, workers, etc. You know, they fear that if I tell you I'm sick, now, you know, the team can't play for 7 days, or we can't practice for 7 days. And those protocols change every day. You know, it used to be one person is sick, the whole building closes down. And it's changed to, you know, that person was sick without a mask within 10 feet for longer than 20 minutes, et cetera, et cetera. So there, you know, a lot more people are starting to indicate, yes, I don't feel ill. But the priority I think that we're trying to emphasize is if you have any symptom, even if you think it's just a cold or it's an allergy, you know, we need to take the precautions to ensure that you don't infect the whole team. And, you know, that happened. I know there were some teams this past weekend that happened, is that they ended up infecting more team members, and therefore they didn't have some of their starters. And I probably don't need to belabor this point, but one of the questions I also submitted was what platforms will we need to be used for virtual games recording and viewing? Zoom. I know I talked to some basketball coaches that used a huddle to put some tape together for our student athletes to highlight. I think one of the concerns from our parents is making sure that our students who do have the potential academically and in the sports world that they may qualify for a scholarship, will we have the capability and capacity to help by providing those tools?
Certainly. So once again, there was a lot there. If I was trying to take some notes. No, that's okay. I was trying to keep track of everything, but I'll jump back to something you shared about young people being hesitant or somewhat afraid to sometimes share if they're having symptoms. And I think what's important to point out to that is that even during the fall, we shared with coaches that we don't want any student to feel isolated or ostracized or penalized for getting sick. You know, you can get sick a number of ways in different contexts. And even though we're asking our student athletes and their families to conduct, you know, a higher level of, I guess, scrutiny with their actions, because they are afforded this opportunity, you know, when it's available, that you have to do a little bit more, right? You have to be a little bit more, you know, on point with your daily routine to make sure that you are washing your hands, probably more so than the next person. You are making decisions about whether or not you're going to go participate in activity X or Y or Z. And that doesn't just pertain to, obviously, the student athletes. We need parents to make those same types of tough decisions if they're in the home of a student athlete, right? And I heard Board Member Brown share at the beginning of the night about, you know, people who were watching the Browns or watching the Buckeyes, you know, last night. If you're a parent of an athlete, maybe this year, you know, maybe you choose to watch that at home, you know, just with your family, right? So that was one part of what you shared. Another piece of what you shared just now was about sort of the recruiting piece, and you talked about NCAA and videos, and you also talked about live streaming. So I'll start with live streaming, and then I'll kind of go into some of the video recruitment piece. So one of the things that we've encouraged athletic directors to do is tap into your family resources. This past fall, we had some families who really are tech savvy. I'm not tech savvy. Paul Brown for Columbus City Schools is tech savvy, right? And so I get that, but I wouldn't know where to begin. Somebody tell me to live stream something. I'll share with you what I do. I go ask my 17-year-old daughter, I say, hey, come tell me what we're supposed to do here. And hand her the gadget, and she kind of takes it from there. And so this past fall, there were some families who set up their own live streaming, Facebook Live and YouTube Live and those things where they stream the games. And so we'll begin there by tapping into some of those resources, and then we'll tap into the district's resources to try to find ways to live stream games. Because as a parent, right, what you really want at the end of the day is to be able to watch your kid. Now here's kind of, I'll say this jokingly, right? This is like the old school live streaming where you can't be there and you ask someone who has their cell phone to put it on like a face call, and they're just sitting there showing you the game, right? Because that was what I had to do a few times this summer for my own son's participation. And that, you know, but you do it because as a parent, you want to watch, and I get that. The last part that I think you brought up was about sort of the recruiting, the videotaping, and those things. So it's important to share, right? And this is where I think families will really kind of, I don't want to say love this, but you'll get some good information. So right now, Division I athletics in the NCAA, and for those that don't really know Division I, right, that's your Ohio State. That's your Ohio University. That's your Bowling Green. That's your Indiana. That's your Ball State, right? So those programs right now are what's called on a dead period. And so what that means is that coaches, they are allowed to call kids. Kids are allowed to, you know, reach out to coaches, and kids can do a virtual tour of a campus. And a lot of schools are doing that, regardless if you're an athlete. So parents out there, I say to you, if you have a young person in your home who's a sophomore, junior, or senior, I know our juniors are getting geared up and ready for PSAT exams, but if you have a student, you know, in that proximity, they can reach out, they can go online, they can reach out to universities, and they can get a virtual tour. That is being conducted regardless if you're a student athlete or not. And so what students cannot do at the Division I level is they cannot go on campuses right now. So what are families to do, right? What are kids to do? Well, here's that time where you're talking about like a huddle. This is where you get in as a kid and you start to make these highlight tapes, or as a family, you make the highlight tapes. I asked I asked the person directly, I said, hey, tell me, so who traditionally makes highlight tapes? They said, oh, it's the families almost every time. Yeah, coaches do it, but, you know, a family and a kid, they're going to find what they believe is their best angle, right? And so if you don't know where to begin, parents, I can almost guarantee you your kids know where to begin. I'll make a shameless plug. My daughter this past 7 or 8 months, the Columbus Film Commission had their first ever film contest. My daughter at 17 years old recorded and created a short film about the quarantine, and it won first place here in Central Ohio. And this was filmmakers of all ages. So I think kids can figure it out. So go on there, look at your footage, figure it out, put together your highlight tapes and get those into the hands of coaches because they want to see those things. Now, Division II schools are on what's called a quiet period. It's a little bit different. And so what can happen at the Division II level is that a kid can visit the campus, but they have to make sure they're following all of those kind of special rules. Colleges may not have face-to-face contact off campus. So a Division II college coach really is not supposed to show up to the game and say, here I am, in kind of that juncture, right? So they're under a quiet period, and so they cannot go to the games, but the kids through that relationship can go and meet with, under the certain circumstances of that particular university, where they can go and be on the campus. So I encourage young people to make those tapes, send them off to coaches. Coaches are watching them right now because they're a little bit strapped with what their options that they have. And so I encourage you to make those tapes and get those things sent off. Sometimes it's just a cold call approach where you just, you're sending something, you're not on that school's radar to any level, but hey, you say, hey coach, here I am. I've looked at your university forever and I'm interested and I just want to kind of get on your radar.
And Dr. Clino, you went through the practice and quarantine and schedule and game and playoff slides really fast, and they were each individual. As you go through those, do we have enough time with the quarantine date? If we had practices for most of the sports that you mentioned, even with the 123 date, we would have the opportunity to hold for our students to participate in the majority of those sports.
Yes, Board Member Reyes, or Vice President Reyes, I'm sorry, but what will be available to us, right, obviously, will be limited because there's not a lot of the season left. So when you think of winter sports and you go back to, and I can bring it back up if our viewing public needs to see it, but when you go back to the timelines for different sports, they were set to begin competition the last weeks of November. So when you think that that an entire month and possibly 2 months have been lost of competition opportunities, there's not a lot left before the actual Ohio high school tournament would be set to begin. So while yes, we will have with the 124 date, the January 24th date, there would be time to get in some competition. It wouldn't have the same level of preparation that if you had for 2 months. That, that's kind of like what we've all heard. I think the big analogy would be Ohio State, right? Ohio State football didn't play as many games as some of the other universities around the country. And so in turn, right there, so that part of it comes up. And so that is a real part of the discussion. There will be a portion of the season left. However, it will, before tournament play, there's not as much season left just based on physical calendar dates. Now, one of the things that we have as an option to us, if our coaches and teams and schools select to maybe forego some level of participation in the Ohio High School Athletic Association tournament, we always can get creative like we did for football here in Columbus City and volleyball in the fall and create some extended opportunities.
Perfect. That's all I wanted, because I know that you brought that up and you did that where we did some plays within the district. We're big enough. We've got enough teams to be able to do that. And then obviously you have your protocols. And I know that we're just talking about winter season, but I know in the future we'll talk about a little bit about what is our academic perhaps requirements. I know that oftentimes I know that people don't, because I'm sure people don't think I was an athlete, but I did run track and I played basketball. But in many cases, there has always been some sort of academic standards. We will be looking at those. Those were proposed to go to the academic committee that Dr. Pierce is chairing. And I know that in the past they've talked about, passing 4 classes, perhaps a attendance scenario and things like that. So I'm assuming that in later reiterations of future practices, since COVID's going to be around for a little bit, those will be included.
So yeah, so let me share that. I know there was a portion of academics that was discussed last week at the board meeting, and so I'll start here because I'm a former classroom teacher in our school district. I'm a former building administrator in our school district. So this would be the first message I have for all students in Columbus City Schools, for parents that are watching, right? Regardless if you're an athlete or not, the courses that are being provided for you right now and your learning opportunities for high school students, I'm sorry, let me speak to high school students. those courses all count towards your graduation. The class you're sitting in right now is all a portion of you continuing to move along that paradigm to get closer to one day of graduation. And I don't want to, say that athletics is not important as I share that kind of big picture. But if you're a student athlete, what I like to share with kids when I speak to them is that you want to make yourself marketable. Yeah, kids got a lot of skills and I'm really good, but you have to be almost exceptionally special. And I'm just going to speak transparent for a moment. You have to be exceptionally special to be able to have extremely poor grades and still make it, right? And so your package that you're presenting to any college coach, whether it's Division III, Division II, or Division I, you want to be a qualifier. And so what you're saying is, hey, Mr. or Mrs. College Coach, here's my skill set. I'm really good, but I'm also going to be a kid that can come in right away and hit the ground running academically at your university because I can participate. And so as a kid, you're going to want to make sure that your total package is something that a school would be interested in. So I think that's important to note, that even though athlete or not, make sure you're doing what you got to do in that classroom to get one step closer to moving from 9th grade to 10, 10 to 11, 11 to 12, and 12 to getting your diploma. But along the same line, by all means, if you're an athlete, you got a skill set, improve your total package that you're offering to a university to say, hey, this is everything that I have available for you.
And you got to pass once you're at that university to continue training at a scholastic university level, correct?
You certainly have to continue to remain a level of eligibility. Like I said, unless you're a part of that extremely 1%, right, in basketball that you can show up for a season and take off and find a career in that particular sport, yes, you have to continue to maintain. I mean, so I remember being in school and, I won't say his last name, but I remember our academic advisor, his name was Phil. And, when you were struggling, Phil would tell you, hey, such and such professor said you didn't do or you missed a class. And so you never wanted to get a call from Phil or see Phil walk into practice because he was going to come in there and he was telling on you, but it was a good telling on you because he was keeping you honest.
And Dr. Claire, I know that my colleagues are waiting to chomp at the bit, but did you bring a slide or any information on, and everyone's asked, what were our COVID results for the fall league?
Yes, so I'm not sure, and I'll pause for a moment. Scott, should I report that?
Or we can wait till later?
So the question
was about the fall
COVID data in athletics.
Yeah. Should I report that? Am I okay to report that?
I will defer to the superintendent, Dr. Dixon, on that question.
Okay.
Yes, that data has been collected, Dr. Clarino, and it's been given to our nurse's office, Dr. Kate King. So you should be working in concert with Dr. Kate King and making sure that we have that information and that we're reporting that data accurately. We've increased, we've worked with that department to make sure that our district dashboard, our out-facing dashboard, has that information accurately displayed. Just as board members, the information that you received in your packet on Friday, the numbers. So yes, that information you should work in concert with Dr. Kate King's office to make sure that that information is accurately reported and captured for our district.
So we'll get that.
Yes.
Okay.
So Dr. I don't know if there's President Adair, you want to continue?
Yeah, we have lots more questions.
Yes.
So let's, this is important. We are over time. So I'm going to ask board members if you're willing to continue. We do, we do have several more questions to get through. If we could, be very clear and succinct, but try to stay on point, that would be great. All right. Are you finished, Vice President Reyes? Okay. So up next then is Board Member Cole.
Thank you, Madam President. Thank you, Mr. Clarino. Please feel free to be as succinct and concise as possible in response to my queries. You mentioned some comments about grades. I wanted to speak specifically to the legislation that the board passed the last meeting addressing the waiving of grade requirement as per OSA. You give distinctly and concisely as possible what the details of that legislation entail. Super important that the community and my colleagues even deeper understanding of the fact that that legislation was not where it was giving us the authority to either waive or maintain a GPA requirement. The legislation and their decision to do that is premised on being able to pass 5 courses. Can you please explain that?
So, well, I think what's important to share, and I will try to be as succinct as possible. So in the state of Ohio, the Ohio High School Athletic Association sets a academic criteria for students to participate in sports. That academic criteria is that students are passing 5 classes, right? So if a high school student has 7 classes, if you're passing 5 of the 7, then you are academically eligible under Ohio High School Athletic Association's requirements. That in some people's mind could be viewed as a 1.0 GPA. But the reality is that, and I'm using a big hypothetical here, but the reality is that a student could have 7 classes, 7 of those or 5 of those classes could be passing with a D, and then 2 classes could be Fs. So in that particular scenario, that student would possibly have below a 1.0 GPA, but they would have met the Ohio High School Athletic Association's requirement of 5 classes. Now, school districts are provided the authority, if they so wish to do so, and some do and some do not, to provide to install a GPA requirement for participation in athletics and extracurricular activities. In Columbus City Schools, as all of you are aware, that criteria is a 2.0 GPA for participation. So when you're going to check academic eligibility for a student athlete, you're checking 2 things. You're checking 1, have they passed 5 classes? And then 2, you're checking the district's 2.0 GPA requirement. So in some cases, a kid could have above a 2.0, but if they're not enrolled in enough classes, or maybe they fail too many classes, maybe you have 6 classes on your schedule, you could possibly fail 2 of them, and then you have only 4 passing classes, but you're above a 2.0. So you would be ineligible based on the Ohio high school measures. I share that. So what was presented to you all last week was a portion or was a waiver for the district's policy that requires a 2.0. Ohio High School Athletic Association made the decision to waive their level of academic requirements until the end of this school year, the 2020-2021 school year. I won't speak for them and why they made that decision, but I will speak to then now the request of the waiver. If you go back to the second waiver that was requested from the board, that waiver, we were thinking that there was maybe going to be a possibility, as you all may recall, that students would be beginning a level of hybrid learning on November the 2nd. And obviously we all know that that did not occur. So as Ohio High School made that decision, that was presented before all of the board last week. The request was not to say that we don't want student athletes to, attempt to earn a 2.0. The request speaks to a level of grace and understanding that some young people's learning situation is not the same as others. And so right now, while you're sitting in a scenario where you have before you a new way to learn, which is an online virtual platform. If you think of a kid who at age 4 or 5 started off 10 or 12 years ago and they've been in school all their life and now they're in high school and they're used to the interaction with teachers and people, who are there right there personally to care for them. And now all of a sudden we say, nope, you don't have that available to you anymore. We're going to ask you to learn on a computer. That's not easy to do. those of us that have children on the line, I think can speak to the challenge that goes into learning on the computer. My children in my home are learning on the computer. You know, my daughter at times has looked like, you know, smoke was going to come out of her ears. And I apologize for something. I know you asked me to be succinct, but the bottom line is it doesn't ask for student athletes to do nothing. It asks us to recognize that some students' conditions are not as supportive as others. And so we don't want to take away their opportunity at participation because that policy is in place at the current time. So that would be my understanding.
Thank you for that. I want to get right to it.
Okay.
Despite what the Columbus Health Department is providing in terms of an advisory, this is even a superintendent. This is even more directed to the superintendent. So both of you can feel free to answer. But irrespective of what the Columbus Health Department has recommended, has advised, are you still suggesting or recommending that we have a winter season, however limited that could possibly be? Are you still recommending to us that we have a winter season for athletics?
Yes, Board Member Cole, what we've come to present tonight is just what you stated, that we currently are adhering to Columbus Public Health Advisory. The question from our last meeting was, what are the protocols? We had so many families that were concerned that we extended our suspension through the 23rd. We're bringing to you tonight that we can begin, by providing the guidelines, within our guidelines rather, and adhering to those COVID guidelines as closely as possible, we're able to resume practice. We would like to resume practice in preparation for a January 24th competition. You stated on Dr. Clarino's timelines, he has the restart of January 24th, but we want to get our students back in for practice, because right now our students are not even practicing right now. So we get our students back in for practicing, and then the competition will start January 24th as outlined on the slides. Dr. Hill's proposal is that we begin the professional development for her staff on February 3rd. And then we begin building that program and allowing students to participate after February 3rd.
Okay, so for clarity's sake, it sounds as if you are saying that as in adherence to very strict guidelines as prescribed in this plan, we are willing to move forward. The administration is suggesting a willingness to move forward, advising this or directing this, recommending this and suggesting this to the board, that you're okay with moving forward with sports and extracurricular after school hours arts.
Practicing. I think that's
strictly on a practicing basis.
That distinction, I want to make sure that we're saying that we are recommending that, because we are not practicing right now. We're not doing anything. So we are recommending that we resume practicing, and athletics competition, as stated as Dr. Clarino's slides, his timeline, begin on January 24th. The advisory ends on the 23rd. Yes, but right now, we're adhering to the advisory and we're not even practicing. And so we want to be able to start competition on the 24th, meaning that students will have had the opportunity to do some practicing and then can immediately start competition on the 24th. And that's given, we're making an assumption that the advisory will not go past the 23rd. But there's no guarantees in that. And I don't know if Edward could speak to if the advisory would be extended or not. But we're asking to resume practice.
For me, I guess the most important thing for us to know, irrespective of what Mr. Edwards, Mr. Johnson has to say to us. Again, and this was even asked the last board meeting, if the advisory was extended post January 23rd, what are you then prepared to recommend or suggest to us moving forward?
You know,
Just
as
so
I
we clarify that again.
Yeah, again, we've been following the advisory. We understand if we deviate, there are risks, but we have outlined tonight that we take those risks, we take that risk. Here's some things that we are stating that we will follow closely. So bringing our students back and allowing them to practice, here are the guidelines. And then when during the competition, and if Dr. Clarno can highlight those again, we are saying that even in practice, there's no spectators. Because that, you know, is our students, the coaches, and, you know, and then maybe, I think, again, you can highlight what those things are, even when we, the competition, possibly mask, possibly no spectators, etc. But right now, I am asking that we resume based on our administrative recommendations and how they've outlined that we resume practice. And as the timeline shows, okay, I saw your hand, Dr. Clarno, that competition would start January 24th.
Thank you for that. Go ahead, Mr. Clarno. I still have questions. Go ahead.
Certainly. So to support what Dr. Dixon was sharing just now, you know, for us as a school district, as I shared early on, we were participating in practices prior to the suspension, which was obviously a part of in line with the advisory. And we understand that completely. Having this young people back in practices and being able to prepare for what could be the opportunity of the season, right? And I won't speak to if the advisory is extended or not, but I think what's important is that if practices are occurring, the second someone says go and you can have competition, then that cuts down that lag time in between when we could have a game and us having to wait several more weeks to get our young people in a healthy position to compete. Because what's really important, you know, I asked OSU trainers in the fall, I said, what's some of the issues that OSU athletics is concerned about as it pertains to students who had no spring and no summer workout in preparation for the fall season? And I asked this question again for winter sports. And one of the big things that athletic trainers worry about, it's not that we're saying COVID is not a real issue, but an athlete who's asked to go out and compete on their highest level without preparation, now we got to start to worry about those soft tissue tears. Now we got to worry about those soft muscle tears. We got to worry about those things because the mind, as all of us know, anyone on the line that's over the age of 40, right? The mind thinks it can do things that the body cannot do. Right. And so I think some of us can relate, right? You think, oh, I can go out here and run as fast as I can. Your kids tell you, come on, mom or dad or uncle or grandma, let's go race. And then you go, I can beat this 12-year-old, and you get to running and you take 5 steps and obviously you realize you can't beat this 12-year-old. So I'm sharing to say that the practice helps us be in a position to be ready. And I don't want, but I believe that is some of what our superintendent, Dr. Dixon, was sharing as well.
I thank you for the analogy. My other question then, in concern about competition, shortness of the athletic season in preparation towards any kind of championship piece. I'm always looking out beyond to the point of really trying to get to the substance of what families and our students are asking for, particularly our students who are concerned about getting that visibility as they go out prospecting colleges and universities for athletic scholarship and opportunity. Is there opportunity to do a combine, and combines that specifically give schools the opportunity to see all of our seniors videotaped and playing, those who want to participate in that kind of exercise? Something that coaches could agree upon to put together that could well demonstrate their athletic abilities in the safest environment possible. That's the first question. The second is if not that, where I know a lot of basketball coaches, for example, and a combine is different than a football situation, understanding that completely, but understanding too that coaches in the basketball space or other spaces might want to see share with universities them in action with other players. Is there opportunity to do a senior to senior piece where seniors are competing with each other in any given school in a very designated place or set of designated places, adhering strictly to the protocols?
Certainly. Hey, I appreciate both questions. Really, they're a combined question, if I'm understanding you, Board Member Cole. But yes, we definitely can and will be creative. You know, one of the things that I shared earlier about those highlight tapes and those highlight films, right? And I spoke to that as an opportunity for young people to share with college coaches. And I know some people were probably saying, well, how can we have any footage if we don't have any games or if we're not playing? And I get that. So having those opportunities to play, whether or not it is a controlled setting that's not necessarily on your particular high school team, where you talk about some of those seniors and us filming those things and kids having an opportunity to share that footage. Those are things that we definitely can do in conjunction with our coaches. You spoke about combines, and combine really, like you shared, Board Member Cole, so poetically, is really, you know, like a football term. The basketball world, and I don't want to say that basketball teams don't have individual workouts and things of that nature, but you know, people will say I'm a basketball guy. I was lucky enough to play a little bit. And so a basketball coach is really interested in seeing how does a kid compete, because you can take all walks of life in basketball and some kids don't fit the mold. You see this skinny kid and you think to yourself, I mean, you know, I use as sort of a big example, right? Like those of us that really know basketball, you look at it, Kevin Durant. Kevin Durant is not supposed to be as good as he is, right? Because his body doesn't fit the mold. He's kind of a thin guy and those things. But, you know, a basketball term, he'll dump 50 on your head, right? That's for all our basketball coaches out there that want to smile. Kevin Durant can fill it up, right? And so they want to see how you compete as a basketball player. So yes, both recommendations that you shared just now are things that we'll look into and work with our coaches and find a way to help make those things become a reality. I appreciate that recommendation, Board Member Cole.
And again, I want to make sure that we reiterate the opportunity to video record these pieces in a way that shows quality, that demonstrates something that everybody would feasibly be able to watch. In fact, the same way you would watch a football game on any one of the television stations, a high school game even. My last question is based on GPA. At the last board meeting, I asked, can we identify what the average GPA is, the average grade point average is of our students participating in high school athletics? We get an idea of what the average GPA is. I'm well aware that our minimum GPA was, until, you know, at least in this interval, you know, waived. I did not agree with that. And I still won't moving forward. But understanding that our minimum is 2.0, a solid C, what is our average GPA of students participating in after school hour athletics? Are we prepared to respond to that, Dr. Dixon?
Dr. Dixon, I can share some information here. So what I don't have right now, and I don't know the degree to, you know, I mean, I'll share some numbers as big picture items here. And I don't know how deep of a report we'll get into, but so I don't have sports broken out, but I have school information. So for example, in the fall season, you know, I have the numbers of participants for each school and the number of the student athletes that performed above a 2.0 GPA.
He will follow up and bring and submit that information we'll get that information out to you tomorrow, board members.
I thank you very much. Um, for me, that concludes. I thank you for giving the recommendations, Madam President. Just as I refer to the next person, I really think it's important. It's imperative that we are able to render a yay or nay decision. I think it's super important that we do that. And I say that because our students who came to protest, and this is not just about them, this is about this environment we're in. This is about how do we as a district adjust the best way we know how for our students and staff, and providing them a sense of normalcy, but in rigor and all the things that we want to provide as a school district. But I was very, very impressed and so very proud of our young people who came to protest last week. They did it, and mind you, this is after what we saw in Washington, D.C. These students came together, not only peacefully protested, but made potent argument as to what their stance was and why, stood poised enough and attentive enough to listen to us and our responses to their concerns. I thought that that was just incredibly mature. I thought it was incredibly indicative of the type of protest that we really want to see. A willingness to, as much as you're wanting to be heard, be responded to. Tonight, we owe them a yay or nay. So I just wanted to, moving forward, I just needed to share that. Thank you.
Thank you. Up next is Board Member Ragland.
Thank you, Madam President. Dr. Clarino, if a school or a group of schools or all of our schools are prepared to implement the safety protocols, how soon can practices begin?
We could begin practices this week. My thought would be is to provide a day to prepare, which would be like if we were speaking to right now. I know Dr. Dixon spoke to the return of practices. You know, that would be a day to prepare tomorrow and let coaches begin to notify student athletes of schedules and times and those things. And we could begin as the latter part of this week.
So then what you're saying is we can start preparing for practice tomorrow. Then are you going to declare a specific day when everyone can start practicing?
So let me share that, you know, yes, so we can declare a specific day, but what's important is that we've never set the schedules, obviously, of our coaches. And so we wouldn't begin to take that approach right now, but we would set a begin date. So if a coach says, hey, look, it takes me to process and get everything together, now we'll support them in whatever fashion they seem fit. But if a coach doesn't want to begin on Thursday, or maybe they want to begin on Friday, then the coach would have that liberty. Here's another key point, Board Member Ragland, is that our young people, obviously, as the transitions took place, they also then ended up involved in other endeavors. So a coach may be listening right now, and he or she may be on a chat room messaging board that they use with their players. And some of the players might have a job on Thursday that they have to work after school, right? So they need time to get all of those things in line. But yes, we definitely can set a date to say the return is this date, and teams can begin on this date, and then each individual team work with the players in their particular program to be ready to return.
If a school is prepared to begin practicing tomorrow, will that be allowed?
My recommendation is that we would hold off that one day to allow all aspects of the school to align. You know, the coach, the principals, the administration, the custodial staff. I know coaches are, you know, like coaches right now, for those of you that have communication with some of them, I know they're texting you and chopping at you to say, get it tomorrow for us, right? And I understand that, but we got to give everyone else who's a big part of this whole puzzle, right, to get some things in line as well. And so that would be the important piece, is to let everyone take a deep breath and then yes, move forward from there.
Yes, sir. Thank you, Dr. Clarno. My next comment really is to my colleagues. It would be my hope that if we allow our students to get back to practice and the recommendation from our health experts is extended, that the board would take the reins of the decision-making and vote on that officially so as to take, you know, a real close look at what is being asked of the district from the public standpoint. I know that there are some that would agree or disagree with that, and I get it. But from my perspective, sometimes there are issues that we need to weigh in on officially. And, you know, I think that this is one of them. And so, you know, congratulations to the young people. As Board Member Cole has expressed, I too was very impressed with their commitment, their organization, their professionalism, candor, everything that they did in order to advocate for themselves, as well as their families and their coaches. And in my opinion, that speaks to a broader need for urban districts like ours, for that level of advocacy, for everything that we do to champion student success and student achievement. It would be that in the future, we could see a lot more visual demonstration towards the needs of our students, like we saw with a student-led protest last week. And I heard from a lot of families, I heard from a lot of teachers and coaches, and I hope that that type of culture continues here in Columbus City Schools. So thank you, Dr. Clarno. Thank you, Dr. Dixon and Madam President.
Thank you, Board Member Ragland. Up next will be Board Member Beckerly.
Okay, without taking up too much time, I think I wasn't there, but I know that the advocacy, and we're all proud of the students, because it is wonderful when they take charge like that, and that is an inspiring thing, really. I guess I don't know if I was not paying attention, but I didn't realize until the superintendent spoke that we are actually talking about going back to practice in, I don't say violation, but in and opting not to follow the guidance or the guidelines. So that's kind of the first I'm hearing of that, and it may be that I missed something, and I apologize. I have concerns about that. I think a few things. One, we heard a lot about what's unique to our school district and our population, our zip codes that make us higher at risk. We know that we're the largest district, that there is some concern that, you know, as our students' family members get sick, and we could be taxing our healthcare system and our hospitals. But more importantly, I feel like it's a slippery slope. We are in the midst of a global pandemic, and we're making a decision to not follow the health department guidance. And it's going to keep coming up. We're going to have this, maybe not, and I shouldn't say it's going to keep coming up, but I can see easily how it will keep coming up. And we'll continue to be in a position where we have to decide whether to follow the guidance or not. And it's a bad precedent. Prom, graduation, I don't know if this extension, if this stay-at-home order gets extended. So now they're going to continue practicing in violation of the stay-at-home order. I mean, we have infection rates that are 10 times what's considered acceptable right now. And I just really am concerned about making this decision. And it is not please understand, it is not because I don't value sports. I really, really do. But I do also know that some things that feel like they're the end of the world right now really won't be. And, you know, when we're talking about hospitalizations and people being sick and people continuing to being sick afterwards, and we have no real reason to be substituting our judgment for that of the healthcare officials, other than our colleagues in the suburbs apparently made the same leap of faith without any good healthcare reason to do it. And I'm very concerned about that. I'm not really asking any questions unless if Edward Johnson's still here, bless his soul. I just would be curious to know, thank you, sir. Do you have a lesser concern about practicing versus competing? What's happening in the suburbs now? Are they competing or are they just practicing also?
I believe that other schools are competing currently in winter sports at this time. I think from the health department perspective, I can say that the current stay-at-home advisory expires in 11 days, 3 hours, and about 12 minutes. Whether it's extended or not is up in the air, because that length of time is also longer than a single incubation period for COVID-19, for SARS-CoV-2 virus and COVID-19 as the disease. So it's difficult for us to say at this moment in time, yes, it will be extended, or no, it will not. And so only for the next 11 days, 3 hours, and however many minutes, I can say the stay-at-home advisory is the advice of the local health department at this point in time.
Do you have any sense of whether practicing is significant? I guess intuitively it is, because you're not interacting with other players, so it would be less risky. Okay, never mind. All right, thanks.
And Carol, I wanted to make sure I restated what I stated in the beginning. We have been following the guidance of our Columbus Public Health Partners since the very beginning.
Right.
And so the purpose of tonight's presentation was to outline for the board that if we were to move away from and take that risk, so remember, it's an advisory, it's not an order. And these are the protocols that we would ensure if we moved away from the advisory. And Columbus Public Health has already stated that it is an advisory, not an order. So that's what we're presenting tonight, because of the last meeting, there was so much concern.
Right.
And there was a lot of, as Mr. Cole stated, our students were upset because they're seeing other students that are participating in sports around the county, and we get it. And as I spoke to the students that night, I told them I understand, but I wanted to make sure that we provided to you as a board and a community that yes, we can do this safely and take that risk. And that risk is that we would not be following the advisory during this practice period, not competition. We're saying practice, and then competition will resume on January 24th. Now, being mindful that the advisory will perhaps be over on January 23rd. We don't know. We don't know. That is what I stated after last week's meeting, that I would bring forth, demonstrating to the board and to our community that we could indeed move forward and adhere to those guidelines, but knowing that, yes, there is an advisory, there's some additional protocols that we have to put in place. And this is what that would look like for Columbus City schools.
And what are we doing that's different than what we would do if we waited until after the stay-at-home order?
And that's this unknown, Board Member Beckerly. We don't know if the advisory is going to end next week.
No. That wasn't my question. What's different about these protocols that should give us any more concern pre stay-at-home order being lifted versus when it's lifted. In other words, it seems to me what we've just seen, and I read through them all before the meeting, and they just appeared to be what we were going to do after the 23rd.
Correct.
So what we're doing is the same either way. The only difference is we're only doing practicing now. Between now and the 23rd.
Yes, Dr. Clarendon.
So, good evening, Board Member Beckerly. Hello, how are you?
I'm well. How are you?
Certainly, yeah, I'm doing well this evening also. So one of the things that I believe that needs to be processed and thought about and considered as we're having this discussion, and I get it is a difficult decision. However, the available opportunities for our students and their families and our kids decreases tremendously over the next 11 days without the practice. I know your question.
I understand that.
Yeah, no, so I was just going to share. So I know that, but your question was about what would we be doing differently? You know, so coaches right now can get kids back into the gymnasiums and back participating in smaller groups. So we can still have a higher degree of spreading out. We can make sure that kids are not on top of each other. And if that means that we have to go to a level where there's an extremely small number, a kid being able to have some time to prepare right now, right? That kid is going to be in a better position when the advisory ends or when the suspension ends. And
okay,
so that would be the piece
are there, so we're doing practices differently. Is there a protocol about like fewer kids at a time, or, I mean, are there other things we're doing to make sure the practices are safer than they normally would have been? Not without COVID, but even within COVID, since we're doing it during the stay-at-home order. Staggered practices, that kind of thing. I didn't remember hearing about that, but maybe I missed it.
So no, that was not addressed because as we were discussing till the end of the suspension. But those things that you're speaking to can be implemented into a return as we begin to transition, if that occurs now before the actual date of the 23rd.
Well, that would have been good to be part of tonight's conversation to give us a little more comfort about not violating the stay-at-home order in order to start the practices, because I would feel better about that then.
And again, Carol, it's not a stay-at-home order.
So I'm using
right, because I'll make sure we have that distinction, because when it's a stay-at-home order,
yes,
very different, you know. So it is an advisory, so they're advising us, and that's what the guidance that we have had. But again, remember last week we've had people concerned, students ask questions. So I just want the board to be clear that, you know, we were responding, you know, to the inquiries that, you know, if we moved forward, this is the protocols that we would make sure that are in place. We will highlight those. We make sure that, you know, our parents and our students know. And the reason why I wanted Edward Johnson here, so that he can lay out the landscape, right? You know, and highlight that. And then we had Dr. Bodie that answered some questions too about from Nationwide Children's Hospital. So
we need to be clear that there's nothing that Edward Johnson said that would suggest that the landscape is anything other than supporting a stay-at-home order. And Dr. Bodie,
the stay-at-home advisory.
Advisor.
Right, so I think you have to be.
I'm not intending to do that. A stay-at-home.
We're not saying at all that any information that anyone has given is different from the weekly calls that the community, the weekly calls that the board members on, the information that's given to me as a superintendent. I've been transparent that all that information has been the same, but we have, you know, a community who is wanting to talk openly about athletics and extracurricular activities, and want to know why the students are not participating. And if we could do so safely, what would that look like? And so that's what we outlined tonight, that if we choose to move during the stay-at-home advisory, this is what it looks like. So I just want to make sure
I'm sorry, I keep saying the wrong word, and
yes, because when you say order,
I
it looks
shouldn't
like
say
we're
order, and that's not fair. That
Yes.
is not fair, and I take it back.
right.
I guess what I'm trying to say is the best advice of the public health community right now, in the form of a guidance, is to stay at home. And nothing has been stated tonight that suggests that that's not the best advice. Now, look at, all we're doing is making the same decision, I guess, that all our surrounding suburbs have done. But Edward used an interesting term. He used the word privilege. When everyone in the community decides to not follow the guidance, and you know, I place this concern at the foot of every school district around us that's made this decision. We're not all in this together anymore. And if, you know, and so to some extent, I'm totally sympathetic with, well, why shouldn't we do it if everybody else is doing it? But, you know, as a leader of this organization, I have grave concerns about making this decision in contravention of the health experts. Now, I realize I'm a party of one, but I think it's worth saying that, you know, all of this being in it, maybe I'm not a party of one. I saw some head shaking. But, you know, I just have a hard time saying just because everyone else has decided to flex their privilege, we should too. But, you know.
Yeah. And I think what's important is that we had a public discussion about it. I think that's the piece, that there's an opportunity to talk about it publicly, Board Member Beckley, and I don't think that has been done.
Oh no, I'm very
this
glad
fashion,
we're having.
right? So and people
really
understanding, yeah, that advisory, what it means, what the impact is, what the impact on our community, and the other questions that the great questions that the board members have asked tonight.
You know, and I'm sure as well that it was discussed publicly at all the other boards surround us, and there were probably other people like me that were belly aching about this, or that's not the right term, I take that back, but you know, we're raising this concern, and you know, it didn't carry the day, and that's, you know, as it is. But I just really feel strongly, and I am very worried about the precedent, because we don't know what sorts of decisions are up ahead vis-a-vis the public health guidances, and what other segments of our community are going to want us to not honor them in order to, you know, preserve all or ensure or provide all of these things that are so incredibly important to our students. I mean, you know, and to some extent, you know, maybe the better course of valor, and actually I have a personal story with my son who could attest to this with respect to sports, you know, is standing up in front of our students and saying, no, we're doing the right thing. We are in this together, and we're taking this seriously, and we're going to role model that, because the community is more important. But be that as it may, that's all I have. I don't have any more questions.
Okay, thank you, Board Member Beckerly. Up next is Board Member Brown. We don't appear to be hearing you, Board Member Brown, but you look to be unmuted, so I'm not sure what happened.
Sometimes if you switch back from your computer to your headphones, you have to change it in your mute function.
Okay, why don't we let you figure that out for a moment, if you don't mind, Board Member Brown, and go ahead and have Dr. Pierce go, and then I will come back to you. Okay, Dr. Pierce.
All right, thank you so much. So just for a second, I just want to confirm some of the things that I've heard throughout this meeting, because I think the community may be confused by this kind of question and answer period that we're having right now. So to this point, we've established that we're continuing to see COVID-19 impact our communities where the majority of our students come from. We're continuing to understand that there's a number of social determinants that affect not just the impact on our individual students, but also the impact on their families. And then we kind of moved into this presentation of information from our directors of co-curricular activities, particularly Dr. Hill, who made her recommendation, Dr. Clarno, who made his recommendation for sports. And I think that's where we need to clarify. So Dr. Dixon, please correct me if I'm wrong. What we have said with this presentation is that if the advisory is lifted, we will be set to start competition on January 24th. We expect and anticipate, are hoping that that advisory is lifted. And with that expectation, we are saying that we will begin to move forward with a plan to start practices. Because right now, what is different from our district and other districts is that our students are not practicing. Am I correct in understanding that so far?
Correct. You're correct.
Okay, so my questions then kind of start at that point of us ramping up and starting sports again. So my first question is to Dr. Clarno. Last week we had a number of students, coaches, and staff members come out to voice their concern, right? At the end of the day, while the students called it a protest, the media has said it's a protest. In essence, it was our students, our coaches, and community saying, we want a seat at the table. Our voices need to be heard. And that's a part of our democratic process. That's an important part of democracy, ensuring that every voice is heard. Now, that doesn't mean you're going to get what you want all the time, but it does mean that we respect and listen to everybody's voice. And so in that gathering of individuals sharing their preferences, I specifically sent emails to ask you to follow up with our student Dazon Cox, Julian Jackson, our parents, Ms. Shepard and Mr. Reed. Did you follow up with them and have a conversation?
So if you sent an email to me, I didn't, those names you just shared are the first that I'm hearing of those names. I don't know those students. So no, I have not spoken to them. I spoke to Mr. Rhodes today through a telephone.
Mr. Reed.
I don't know, who's Mr. Reed?
He made a proposal with our parent, Mrs. Shepard. I CC'd and included you on that email with Dr. Dixon. Very good proposal that laid out protocol.
His name is Rhodes. His last name is Rhodes.
So Shepard and Rhodes, I thought it was Reed.
Yeah, it's Rhodes. I read the proposal, Rhodes.
So did you follow up with them?
No, I haven't followed up with them yet today, but I read their proposal. I reviewed it. I saw it. I saw what they wrote to us. A lot of what was shared in their proposal was also the guidelines and protocols that we are already following that were in place. So I appreciate that piece of it. But yes, I saw that. And then there was also a piece shared today that I have not yet responded to. But
that's
I'm aware.
From Jalen Jackson. So Dr. Clarno, I bring this up because what we see happening in athletics, and the coaches communicated this when they were here last week, is a lack of communication. At the end of the day, our community wants to be heard, and they want to know that when they're heard, we are following through with actionable steps. So it's concerning to me that the information was sent via me through email to you and Dr. Dixon. I posted it on my Facebook page, and we didn't follow up with those community members. We need to do a better job, just point blank, period. So the recommendation is, moving forward, can we today make a commitment to our families that are engaged in extracurricular activities that we will communicate with them, that we will provide a seat at the table for them to share recommendations, ideas, and solutions.
So I'm going to ask you, hold on. Dr. Pierce has a valid point, but this is actually an administrative management issue. And I would like the superintendent to handle that as a management issue and not discuss this in the board meeting. Dr. Pierce, could you please move to a next question?
That's fine with me. I hope that we can discuss that offline. I think the next critical issue is we've talked about huddle. Huddle comes with a cost. There's an equity issue there that's involved with not only the teams putting the film up on huddle, but also the individual families putting film up on huddle. So what are our plans as a district to ensure that we're helping our teams and our coaches with the cost of huddle?
The expenditure for huddle is handled differently at each one of our individual schools. Some programs are in a situation where the booster scenario is able to cover the cost of huddle. Other programs do fundraising, and the programs that are not able to cover the cost, the individual athletic director's budget helps cover those costs.
So Dr. Clarno, again, in this discussion, what we've said is we're not going to have concessions. That's how schools raise money, right? We said that we're going to give them a little bit of time to gear up, but our boosters, if they're not well established, don't have that money. So I would like to recommend that we begin to look very proactively at what we can do to ensure that there's equitable use of huddle for our students and our teams across schools. We can't say to our families, oh, use huddle, put some film up there so these college coaches can see you, when a cost comes with it. And some of our families might not be able to afford that cost. So for me, that gets at that equity. And I think we need to be very clear. And when we recommend families to go out and make these films and put them up on huddle. The next thing is the weight room. In your PowerPoint presentation, you said that the weight room will be sanitized after each session use. Well, at the YMCA where I go to work out, Planet Fitness, you sanitize it after each person uses it, not after each session. What stops us from doing it after each person uses a piece of equipment versus after each session?
Nothing. A session in that piece meant a rep of a person using that piece. That's the session. You use the piece of equipment and then it's sprayed down. The disinfectant bottles are there. So
I would like to recommend
if I may share, Dr. Pierce, I don't believe that parents have to pay for huddle. That's a school cost.
A school cost, but it's still inequitable. It's still inequitable. We have some schools that can afford to put more film up than other schools. So again, I recommend that we deal with the equity cost of it. And we can talk offline because I have example and coaches have called me about it. The next question then relates to, well, the weight room. Can we be clear and specific to say sanitize after each use? Because I think, again, there can be some confusion there with use versus session.
I appreciate the recommendation.
The next question then relates to our cleaning supplies. Now, when we have fall season, there were some coaches that were given supplies by their custodians, other coaches that had to go buy supplies. Can you tell me today, will each coach be provided with cleaning supplies weekly? And if so, who will give them those supplies? Is it the AD or is it the custodian? Again, I think we need to be very clear in that. Where are they getting the cleaning supplies from?
Yeah, they'll get those cleaning supplies from their athletic director. And I appreciate you sharing that there were coaches that made a decision to purchase items in the fall, because we had those items available in the fall for coaches as well. So I appreciate you sharing that occurred.
Thank you. The next two issues get us back to equity. So during your comments, you mentioned the sweaty sweatshirts, that teenage boys will wear a sweaty t-shirt for a whole week. While I'm not a teenage boy, I am a student whose family didn't have a washer and dryer. And so after games and after practices, I had to wash my uniforms out in my tub. So we need to be mindful that there's instances where our families don't have resources to wash their clothes or buy the PPEs. And it's not always because it's a boy being a boy or they just didn't wash it. It's because they don't have the resources. They're putting food on the table. They're making sure that the heat is on in the house. So I would like to recommend that if we do identify students that need additional help of washing of their uniforms or washing clothes, that we as a district help to provide at least resources where they can have access to a washer and dryer. I know some of our schools provide that access. I know some of our coaches take the items and wash them themselves. But I think we need to look at this again from an equity lens. We are dealing with a pandemic. Many of our families are struggling and may need additional resources. So we need to be mindful of that.
Certainly, I appreciate that. You know, I too understand that there, you know, I'm a 20-year person in this school district. I can remember multiple times as an administrator in different schools that I've worked at, from Lyndon McKinley to South High School, where we had young people who didn't have some of those resources. And yes, we've helped them out to be able to wash clothes and things of that nature. So I totally understand that and get it. And I think our coaches, through their relationships with their student athletes, also get that. The analogy that was given about the teenage boy is more so as another adult voice of a reminder to say, hey, if you know, make sure you're taking care of these things. Not to say that you don't possibly have the the resources to take care of it, because any coach that I know in our school system that sees those challenges come up, they do provide that level of help and support. So it was really more of an analogy to say you do also, while you have the one scenario that you provided just now, but you also do have the teenage boy scenario. The one doesn't cross the other one out. Some teenage boys are also just like that, and they have the resources.
Well, Dr. Claire, no, as a Black man living in America, you know that perception is sometimes everything, even if it's not right. And so what I would prefer as a proud product of this district is that we be mindful of how we frame conversations around our students. Because
Certainly,
I'm very mindful that even our young males want to look nice and clean and fresh.
Yeah, I agree.
So that's what my recommendation was.
Okay, okay.
The second question.
Dr. Please don't talk over one another. Right, Dr. Clarno, don't talk over Dr. Pierce. Dr. Pierce, don't talk over Dr. Clarno, okay? How many more questions do you have?
This is my last question, President Adair. Thank you so much for answering these, because they're, again, all about equity and framing. We can't highlight our young students for coming out to give voice and protest, as we would say, and then make comments about them not wanting to be cleaned. The last question then relates to scholarships. So when we talk about scholarships, one of the real realities that we're going to have to deal with is that many of our colleges and universities will not have the same level of scholarships to give out. And so we have not to this point had a real reality kind of gut check conversation with our families to say, look, a lot of these schools, while you want your student to come out and play and we want them to have a season, don't be disappointed if those scholarships, those letters, those offers do not come in. A lot of colleges and universities and teams are taking budget cuts and do not have the same level of funding that they had in the past. And so what I would recommend, again, is that we be very intentional in thinking about how we can approach that conversation with our families. And as we approach that conversation, I think it's also important to start having the conversation earlier about how you obtain a scholarship. So your senior year is a great time, but coaches are looking at you really your sophomore year. They're looking at you being a real high performer your freshman year. They want to see some growth your sophomore year. By your junior year, they're determining whether they're coming to your games and whether they're going to give you that letter. And so I think we really need to make opportunities to ensure that our families, our students, and our communities know and understand that scholarship process like the back of their hand. Those are all my questions. Thank you so much.
Thank you, Dr. Pierce.
President Adair, since there was a directive there, I just want to ensure, Dr. Pierce talked about equity in this. She's asking for some research in mentioned sports. I know that some of our band programs and our theater programs, they also want some research done on how there are some avenues to help them. They are also not getting concessions, since we are talking more holistically of not only sports, but also about theater and extracurricular activities. If that was a request or directive, I want to make sure that we're doing it across all of our students. We all know that there's lack of resources throughout our district. So before something else came up and I forgot, I just want to make sure that it's inclusive of not only sports.
Okay, yes, good point. Also, I know that she used the word directive, but she cannot direct. 3 board members have to direct 4 board members. So she's making a suggestion, just as we always do, and it will go on the list as we always do. But yes, your point is very well taken. That it is, and I'm sure Dr. Pierce would agree with that. She didn't mean to just highlight athletics.
So I don't recall using directive. I thought I said recommendation. I meant directive in terms of when Dr. Dixon follows up with Dr. Claire, know that she handled that directive as she sees fit administratively. And yes, I do agree with Board Member Reyes that we look at it from a holistic approach for all of our programs.
Okay, thank you for that clarity. All right, Board Member Brown, is your mic working?
I hope so. What do you think?
It is. Perfect. Go on.
Wonderful. Let me first just a minor point with respect to what Ramona just had to say. And you know, if the word directive was used, it shouldn't have been. No board member or 2 or 3 have the authority to direct the superintendent, particularly not on administrative matters. Even the whole board doesn't have that authority. We do work together with her, but most of the decisions that we're talking about tonight are administrative decisions. I disagree with my good friend, colleague, Ragland, that this is something that we should vote on tonight, because I don't think that, like opening or closing schools, it's not our call. It's an administrative decision. And clearly, Dr. Dixon is not making any decisions without consulting with us and knowing that we've got her back. More importantly, everything that I've heard tonight, everything that I've heard leading up to tonight, conversations with parents, conversations with kids, all of my prior experience, and there's a lot of that. And I am a strong proponent of sports and other extracurricular and co-curricular activities. I always have been. I've always participated. I had 4 brothers come after me, all doing sports. We were referees at times. I continue to be a fan. And I know the value that participation in sports can provide. Nevertheless, our first and foremost priority must be the health of our kids and their families. And our primary purpose and our mission as Columbus City Schools is education, specifically academics. Here we're talking a great deal about sports and to some extent the rest of the co-curricular activities, as though we must rush and get them active and back to some sense of normal sooner than anything else. And as much as I love sports, I don't see it that way. If we cannot and are not ready to bring our students back into the classrooms, then I don't see what we're doing and even considering allowing sports to proceed. I'm in agreement with Board Member Beckerly. That under no circumstances, from my perspective, should we be resuming activities, whether curricular or co-curricular or anything else, beyond the advice of the health professionals that advise us. If they currently have, and they do, January 23 as the date the stay home suggestion expires, then we ought not do anything with practice or competition prior to the 23rd. If the health authorities extend their stay at home advice beyond the 23rd, and we all concede that the numbers of cases is extremely high. It's the highest that it has ever been. Yes, we know more. Yes, a few people have gotten vaccinations. Most have not. But the numbers are not very encouraging, and nothing I've heard tonight suggests otherwise. I know that's something that Carol said, but I too have not heard anything this evening. I do like the work that has been done. Dr. Betty Hill, Vincent Clarno have done great work on this. I believe that their plans encompass all of the things that we heard from the several parents that sent in suggestions. And if there's something in those suggestions that would allow us to improve, I have no doubt that they will build those in. Those things are plans for once there's a decision made to return. But nothing that I heard in those plans suggests that we return sooner than we otherwise would. So I really don't like the idea of not following the advice that is given by the experts. I really believe that we need to follow the evidence and the science as they give it to us. We can ask questions, and we should, and we've had good conversations with Columbus Public Health, Nationwide Children's Hospital, and others. But I just don't understand why anybody is now considering jumping the gun before the advisories expire. And, you know, and if, as I said, if they don't expire but are again extended, that's for good reason. That's for good public health, community health, family health reasons. And we ought to abide by it. Thank you.
Thank you, Board Member Brown. So board members, we were supposed to move officially into our discussion, but I feel that we are already kind of there. If you would allow us to just say that we are kind of in that. I believe everyone has had an opportunity to speak, and I know some of you want to add a couple more thoughts, and we will come back to you. I just wanted to say that, just because a couple of you have said it a few times, we are not voting tonight. These special meetings are not places where we can create official vote. And in fact, you know, as we have gone through COVID, we have left these kind of decisions about the administration of the school to the administration. what we are doing tonight is, you know, having this public discussion, seeing where the consensus of the board is, to basically help the superintendent make the decisions that she is recommending. And that is that we go to practice, we start practice. That is a technical violation of the health order. As with other districts, and as some of you have stated, there is a risk. There's a risk analysis to this. And so in the analysis that the administration is proposing, you know, there is a risk that our students, that our community could get COVID based on this. But they feel that the risk is outweighed by the benefit to our students and being able to practice and be ready for competition in a very shortened season. You know, we talked a little bit about, well, what happens if the order is extended? I have not personally yet heard what that is, and perhaps we're waiting. But it goes back to something that board member Beckerly said, and that is, you know, when we decide, or when our administration decides not to follow one of the recommendations, because they are recommendations, they are not orders. As then a board and a governance model, we need to figure out then how we address the next one. Because right now we've had a zero, we basically have said, here's the health order, we're following it. So we have things in place in the future that we're going to have to come up with this again. For example, transportation, for example, graduation. You know, so there are things in the future. And so if this is the format, or this is, you know, what we're going to do going forward, where we will have public discussion and analyze the risk, and leave the decision, as we have this entire COVID period, to administration, you know, I'm fine with that. But tonight we are not voting. It is about consensus. It is about the superintendent hearing where we are, hearing from, you know, the community, and the community has shared a lot with us. But that is kind of where we are now. Personally, because I have not yet shared, you know, in this risk analysis, in this 11 days to this order is done, in the benefit to our student athletes to be able to practice in small groups. And I do agree that maybe we could have a little bit stronger. I saw some really great, stronger suggestions from some of our community members about how to make things safer. I personally am okay with taking the risk to start practice. I am concerned, though, about the slippery slope of what happens when the community comes back for the next thing. And so we have to really think about that, because COVID is real. COVID is still happening. Our community is at risk. We have systemic inequity that make our community at greater risk. And we have to keep all this out front and talk about it in the open way that we are, because this is hard. These decisions are hard. And right now, we, as the Board of Education, as the superintendent, as our district, have really gone with that. We are going to do what's in the best interest of our community on the health scale. And we have just said we're following everything. And this is a shift. And I just want to clearly say that our administration is asking us to make a shift. And there will be a next time where we have to consider what we do. So that's where I stand. We're going to go back to a few more comments and questions. And then, since we have officially kind of moved into that discussion, just want to make that clear. We move into the next agenda item. So we are going to hear from, let me look back at the list, Board Member Beckerly, then Board Member Pierce, then Board Member Cole. And I believe that was all. I'm going to do a last call and then turn it over to the superintendent for her closing comments. Okay. So Board Member Beckerly is next.
I'll be quick. Yeah, I wanted to reiterate a recommendation and some, you know, request that you consider in the intervening time before the stay-at-home guidance is lifted, to really come up with some ways to do practices more safely. I think that that's a reasonable thing, and I bet it's, given that all the games and other things aren't happening, it's probably feasible. You know, the facilities won't be utilized for other things. So anything we can do to even mitigate the risk further, I would certainly appreciate that. Oh, yeah, and you know, Eric was right. This is incredible work that's been done and thoughtful work. And I didn't say that and I should have. So thank you all, Dr. Clarino, Dr. Hill, and everybody else who thought about it, that you know, it's no small task to figure out how to do this safely. And, you know, it's work that will be, you know, relied upon and put into use for probably, you know, the foreseeable future, given where we are with this disease. And the other thing I think that is important to point out is that we are, and I don't know if I'm getting political or not, but we are in an unfortunate situation of being presented only with a guidance. It was not a health order, even though I called it that half a dozen times. And the state has, you know, so our local authorities haven't issued an order, our state has an issue order, and the federal government hasn't issued an order during a global pandemic of unprecedented, unimaginable proportions relative to anything we've experienced. And the result of that is that it places us all in these impossible situations, making these impossible decisions. And that's really not fair to any of us, because, you know, we needed them to be orders and they weren't. And so that's why we're in this spot right now. And it's really hard. And you know, Eric said something else, which is true. And absolutely, after we've said all of this, of course, we have your back. And we understand that this is, you know, this is not being taken lightly. And, you know, we got a lot of kids that want to play sports, and that's not a bad thing. Anyway, I'll stop talking because I don't need to say anymore, but I did want to say that because part of it is we're here because of a failure of leadership up the chain.
Okay, thank you, Board Member Beckerly. Next is Board Member Cole, then Pierce, then Ragland. Thank you for correcting my order, board members.
Thank you. I was okay with ladies first, as I stated. Ms. Pierce, if Dr. Pierce would like to go, you more than welcome. All right. I'm thinking about this circumstance and I'm considering, you know, my son working, considering if, you know, we were to let him, if he were in this situation, would we let him play? And I'm pretty confident we probably would. The thing that I really want us to be very deliberate about and very clear and deliberate, definitive about, and I want to make sure I'm clear with it, that I don't want to give something and take it back. I don't want to play like that. I don't want to dangle carrots. If we're going to take the risk, I'm willing to take the risk. If we're going to take the risk, I want to make sure the proper risk managements are in place, not just for management of the virus, but also management of our risks, our organizational risks, that the proper instruments are in place. If waivers have to be signed, if something has to be filled out, then it's filled out. The second piece is that the community understands with great clarity, this will not convene the way you want it. It will not convene fully the way you want it. Hate it or appreciate it, love it or like it. That is what it is. I'm for it, I'll support this, but it's not going to be this normal type of thing that we're used to organizationally in practice. And again, I really want to state, if we're going to take the risk, give them the season. Give them the season, period. Whatever comes down in the 24th, give them the season. I've told many of you on many occasions that I make decisions by what I call best judgment. I know the facts, the ones I want to hear, and the ones I don't necessarily think I want to hear. I've looked at both sides of the coin. I know what my sense of rectitude is, right and wrong for Michael, right? And lastly, I know the value of what I'm willing to gain or lose in my decision. That is how I wake up every day after these meetings or any decision I've made and know I'm a man standing doing it, period. So if we're going to do this, and final, no Indian giving And I don't mean that as a pun or disrespect for our emotional sensitive folks this evening who are watching, if that's the case. I don't mean that to be an insult, but no giving and taking back. Secondly, if we're going to manage the risk, let's do it to the fullest extent. Thank you. I hope that we move forward and give our students their season. Thank you.
Thank you, Board Member Cole. Dr. Pierce.
So one, I think it's important while we're having this discussion. One of the things that we did not hit on was our conversations with OSHA about eligibility. We have some students, if Dr. Dixon decides not to move forward with the season, they have lost a year of eligibility. How will we petition that OSHA make an exception to give those students a year eligibility back? I think the other thing that we have failed to discuss in this conversation is the tournament play. Can we petition OSHA to push back the start of that tournament play to give our students the opportunity to ramp up so they can be competitive with their peers? So I think, or once we decide, however we're moving forward, OSHA needs to be included in our recommended plan of action, both those elements, the eligibility and the tournament play. I will also say that the start of competition on January 24th is literally a week before Dr. Dixon has said we will return to blended learning. Our students, our coaches, and our families said sports was a part of it, but they also said they wanted to get back into the classroom. And so please, please, as you make your decision, be mindful that our students want to get back in the classroom. If we start these practices, if we start these sports, then we better on February 1st be ready to get our students back into the classroom, because that's really what they want.
Thank you, Dr. Pierce. Board Member Ragland.
Thank you, Madam President. Couple of things. I want to clarify my comments around the vote. I wasn't asking for us to vote on this. The decision has been made. What I was asking for us to vote on is if there is an extension of the suggestion or recommendation. I was not asking for a vote tonight, but I am asking that if we have to make a decision and the recommendation is extended, that this board go on the record as representatives of the community. That is our job, to weigh the community's input, hear from them, and make decisions that are guided by not just the data that we receive from professionals, but by the community's input. And I think that's important. My next issue is really around advocacy. We mentioned that we have to take into account what the community has guided us in doing. And it might be a slippery slope, someone said. Well, in my opinion, that's something that this district is not necessarily used to. Hearing from the people and doing their will. But you know who does hear from the people and who does do what the people tell them to do? All of the other districts that are in hybrid learning right now and that are playing sports. Now, one thing I would agree with Board Member Brown on, we need to be getting students back in the building as quickly as possible. We talk a lot about inequities. Academically, what is happening to our students in an all virtual setting is criminal. We've got data that has been presented to us that show how difficult of a time our students are having. And we continue to allow that inequity. And then on the flip side, tonight's discussion is about athletics, an arena where we know that many of our students are naturally more gifted athletes than many of the competition that they play against in some of the suburbs. And yet our students are the ones not being allowed to display what comes naturally to them. Our students are not being allowed to share their gifts with the world. And the reason I'm asking for this board to make a decision, if need be, is because there's a difference between having the superintendent's back and hiding behind it. And oftentimes, when there are issues of public import, we want the superintendent to stand out in front, take all the bullets, while we stand in the background and say that it's an administrative decision. And I feel that our students have been disproportionately negatively impacted by that culture existing in Columbus City schools. And so I appreciate the work of the administration tonight by bringing us the data that they have, by bringing us the plans that they have. I would have liked to have seen the fall sports COVID numbers. That would have helped in this discussion today. I will be looking forward to them. However, my message to the public is keep advocating for what you know is best for your students. Thank you for your work.
Thank you, Board Member Brown. Board Member Ragland, I'm sorry, Board Member Brown. Did you have something you wanted to say?
Yes, briefly. Just wanted to, I guess we, and I know for myself, been focusing just on the question that was scheduled for discussion tonight, which was extracurriculars, co-curricular activities and sports. And without regard to talking a lot about when and how we reopen schools for academics. We're planned for, and I don't disagree, for returning to hybrid in the near future. But what I had to say about our kids' health and safety and that of their families continues to compel me to say we ought not jump the gun on health advisories. We have experts, they're empowered, and they have the expertise and the information to be able to make wise, scientifically based, evidence-based recommendations. And I think that just as I described with sports, we ought not reopen or go forward with hybrid learning if the health authorities recommend the stay-home order be continued. We don't have any control over COVID and its spread. We know that it's much, much higher than it was in the spring and the summer and the fall. And it will continue to get higher. The numbers that resulted from all the holidays and other things have not yet come in, have not yet impacted those numbers. But I think that bottom line is that we not move forward contrary to the advice of health officials. Thanks.
Thank you, Board Member Brown and Vice President Reyes.
Thank you, President Dare. I just wanted to make sure, and I know it's noted somewhere, but since the issue of practicing possibly within the next few days is coming up, can we ensure that we solidify and tighten up our COVID processes and procedures and post them and share them everywhere? Since these processes and procedures are not only going to be for practice, but potentially if we go play and potentially, something that we did not address today because it was not the purpose of today's meeting, which is if we go back to school. They're going to be very, very similar. The cleaning, the wiping, the social distancing, all that stuff. So we got to make sure that our community knows and hears and adheres. We do have a large number of students and faculty and staff and people who are involved in this district, and want to make sure that our numbers stay down so that our kids will continue playing or practicing, or we can go on a trajectory of getting ourselves back into school, getting our kids back going, and our teachers who want to connect with our kids back together. So I just want to make sure that I reiterate it, that we share somewhere, somehow, as often as we can, where those procedures and protocols are going to be, so that our athletes have them, our parents have them, where they need to go, so that we are well prepared to jump right in once our superintendent's decision is going forward. So that's what I want to share. Thank you.
Thank you so much. All right, back to you, Dr. Dixon, for closing comments.
All right, so thank you, Board President Adair, and to our board members. I first want to start and say to all of you, thank you for listening, and thank you for giving me this opportunity to bring this information in this format. As I stated last week when we were talking about it, there were a lot of questions that we thought it would be best to discuss this in a special meeting with one topic, with experts to help us guide and think about the things that are implicated. Board members, if you check your email, that information about the number of cases was sent. I think it was sent to you tonight. We thought it was in there Friday, and that information there. Scott Wortman, I'll let him speak to that number in just a second, just to give the number out publicly. These decisions have been tough. Since we have been following the COVID, guidelines in this pandemic, there have been many, many tough decisions that we don't take lightly, decisions that I recognize as a leader. My decisions and what happens to my students is very different to what I see was happening to students throughout the city, the state. And I wrestle with that too. Am I making the right decisions with the right guidance? Are my students being treated equitably compared to their peers? I recognize that. When those students were here last week, I went downstairs, introduced myself to them, shared with them that I was a high school principal at a school in Columbus that had a big sports program. We wasn't in global pandemic. We didn't have advisories like we have now. And I recognize that. But on the other hand, we also talk about the social and emotional learning that our students are going through right now, right? They're looking at a device. They don't have a lot of face-to-face interaction with their teachers, none face-to-face interaction with their teachers. They are looking at their teachers on a Chromebook. They need something, some social outlets of some sorts. So last week when we talked about it, and I want to say this to our public, thank you. Because good, bad, or indifferent, they have stayed the course with us. I think last week was when the advisory was extended, that's when people decided, some of our members said, okay, enough is enough, superintendent. Right? We're tired. You know, our students are going to miss yet additional opportunities. And then that was an opportunity for me and to get with the team again and say, could we do this one piece safely, right? Are we willing to take that risk to say, if we allow our students to practice doing advisory, what does that mean for us as adults? What do we have to ensure, the protocols that we have in place to make sure that our students are safe? We don't want to compromise safety. But if we take that risk, what does that risk look like? Making sure that adults make sure that our students are socially distanced. The adults have to make sure that our students wear their masks. The adults have to make sure that our students aren't congregating. Those are things that our adults have to make sure that we have in place for our students. We have to make sure. And so when I asked the board last week for me to come back and say, if we were to do this, this is what it will look like. Knowing there's an advisory, knowing and adhering to parts of that, right? It's just like we recognize Columbus Public Health is saying, hey, we don't recommend you do this. You don't have to follow it, but we don't recommend you do this, right? And we're saying that we believe that we can do this safely because there's a smaller number of students, while also we're planning for reopening in person. I've stated that the target date is February 1st. We've communicated that, and we've been working to say we want to bring our students back February 1st, as many as possible. Again, adhering to those guidelines that we're bringing our students back in safely. And then tomorrow, we're prepared to make that announcement of those students groups that we want to bring back on February 1st, right? We can't bring all of our students back February 1st. Because again, we have some COVID guidelines and limitations with capacity, for example, in transportation. We recognize that. But February 1st is the target date that we want to bring back our students in small cohorts. Not all of our students, but some of our students, and bringing those students back in safely. The recommendation is for our students to begin practice as early as January 15th. That would be a Friday, January 15th. Knowing that protocols, Dr. Clarino will, along with him, Maurice Odom, and Dr. Stanford, are going to make sure that those reopening guidelines are in place. That's part of our reopening plans. That if we do this and we do this safely, this is what it will look like for those number of students that are participating in athletics from January 15th to January 23rd doing the advisory. And then on January 23rd, if that advisory is extended, then we need to go back and look at it again on January 23rd. So and competition won't start until after January 23rd. So we're talking about resuming practices for students at that time. I recognize what's happening in the city, the number of cases in. Is it scary? Absolutely. We're hearing the numbers. Columbus Public Health has been very responsive by providing those community updates. I know the board members are there. We have members that are listening to, and we as adults, or even, we make sure here at central office and other places that we're following those guidelines. We are socially distanced. We wear our masks. We have our barriers. And we want to make sure that our students have that opportunity to practice with our coaches adhering to the guidelines. Our coaches are monitoring. Our coaches are informing our parents. We are providing the coaches what they need. So this is where our adults are going to have to make sure that we're providing the supervision for our students. And we're reporting that data. And when we see cases between now and then, practice, we have a protocol. We're following those protocols of what needs to happen if a kid tests positive. So we will make sure that those guidelines, those protocols are in place. And if they're not, then Dr. Claire will tell that coach and those families they're no more practicing for that team. We can't take that risk when we know that people aren't following the guidance during this period. Absolutely not. So when we state that there will be no parents, we don't want any spectators, we want our families to listen, adhere to that. We're allowing our students to have this opportunity. But what this means is we can have spectators in the gymnasium when this happens. And our coaches have to adhere to that. And if our coaches go against that, there's a consequence for our students. Those are the things that we have to make sure as adults that we're very clear about during this period. And then we're working again to reopen. We want our students back. Our students have not been back since, with us since March 1st. Well, the end of March, rather. We are ready for our students to come back. Our teachers are ready for our students to come back. They want to be, but they want to do it safely. That's important. So we're excited about the opportunity for our students to come back safely and in class, in person, February 1st. We have more information tomorrow. But we also are mindful that allowing our students to come back and practice, there's a lot of things that our adults will have to ensure and make sure those protocols are in place so that our students can have this opportunity. So that's the request. We wanted consensus from the board members and being mindful of that. Again, if this advisory is extended, then we come back with next steps. If the advisory is extended past January 23rd, then we will have to rethink competition, right? So we're saying that this advisory, during this advisory to the 23rd, that we are practicing with the assumption that competition starts on the 24th, right? But if the advisory is extended, then we may have to, we will rather come back and rethink if competition will begin the 24th if the advisory is extended.
Okay.
Thank you.
Thank you, Dr. Dixon. Actually, I think Scott Wortman has the numbers.
Thank you, Scott.
That is, yes, out there. Go ahead.
Thank you, President Adair. Board Member Chip Ragland, to your question about the COVID data for fall sports. Between students and staff for our fall sports, we had 19 positive cases and 60 people quarantined. And that was students and staff across all fall sports.
Mr. Wortman, do you know what the total number of people that were participating? So is 19 big or small compared to who was all out there?
I will call on Dr. Clarno to provide that answer.
The number that we began with for last season for fall sports was 1,528.
Thank you. I saw Mr. Cole's hand and then Board Member Ragland's hand.
Thank you. I just wanted to say again, I don't want us to be in a position because I just have full confidence that there's not going to be, we're going to get the same information from our health professionals moving forward. I just do. I even heard the gentleman say on the call that they're not expecting things to, level out or begin to truly recede until 3Q of this year, the third quarter of this year. I don't want to put our students in a situation again and compromise the integrity of this organization by dangling a carrot. So if we're going to give them the season, let's give them the season. Protocols have been established. Let's adhere to the protocols. Madam Superintendent, everything you just said in terms of consequences and repercussions, I thought were more than appropriate. I think it is a clear mandate established to the community that parents, it's time for you to parent. You advocated for your student to have the opportunity to participate in sports. Now it's incumbent of all of us to have an all hands on deck approach, making sure that we're adhering strictly to the protocol. They understand. They don't, they should now, with even me saying it. If you're going to participate in practice, then, or participate in competition, then you must adhere to the strict protocol established. But I don't want to dangle a carrot, Dr. Dixon. I just think that puts us in a bad place. It does. Thank you.
Board Member Ragland.
Thank you. Dr. Clearno or Dr. Dixon, was there a health advisory in place during the fall sports season? A stay-at-home advisory in place during our fall sports season?
I don't recall, Dr. Clarno, or Eric Rausch. Can you answer that, please?
Yeah, the first stay-at-home advisory was issued on November the 20th, 2020 from the county and the city. All previous orders were during the spring from the state.
Yes, sir. Thank you. Thank you, Dr. Rausch, for that clarification.
I believe that if I remember correctly, it was the weekend of the high school football finals.
Yes.
So we did allow our teams to finish.
Yes. Thank you.
Right. Thank you, Madam President.
Okay, it looks like that would be all of the comments. So just to be clear, Dr. Dixon has made the decision that students will start practicing January 15th. And if the health order is extended, we will discuss, and I will offer time on our next board agenda, which is before the advisory. If Dr. Dixon wants to think through any of that, again, in a public part, we can maybe put a little bit of time if she needs that on our January 19th agenda, which is prior to that next week. So if you need that, Dr. Dixon, we can offer some time on that. But that is where we are right now. Vice President Reyes.
I know you're closing up. I just wanted to, I didn't know whether you were going to let us, so I wanted to thank Dr. Dixon. I know a lot of us, not only our community, but some of the board members were a little bit in your ear, asking you questions about, if there's an opportunity, what would it look like? I appreciate you, Dr. Clarno, Dr. Hill, all of you coming back and really giving us a lot of information. It was a very long meeting. I don't want it to go without saying that it wasn't something that was not being considered. We've been looking at it every single day. We know, we hear, we have kids in the district. We have cousins, nephews, neighbors, friends' kids, and we know what the impact of COVID is doing to them. and the lack of activity and some of these things that bring you joy, that make you happy and movement. So I just wanted to thank you all, because I don't want tonight to go without that, because this is a lot of work, big decision, and I know, Dr. Dixon, you said we're doing this, and and then you, as this goes and continues and it's not going away for a little while, you said let's look at it and ensure that we look at it in a holistic area. So I wanted to just thank you and all the board members and community and everybody who came and you listened and you gave us an opportunity to look at it again. So I just wanted to say thank you.
And on that note, okay, Board Member Brown.
I just want to follow up. I agree with Ramona. I too want to thank Dr. Dixon and everybody on your team for really good work and for listening. And you know, you've got my support. I know you've got the support of 7 board members. I'm confident of that, and you should be. It wasn't, exactly where I wanted it to be, but that's okay. We're going to do this as well as we can under these circumstances, and make adjustments as we go. No matter what we had come out with, we're going to have a lot of people not happy with us, and that's the nature of this role. So thank you.
Thank you so much. And thank you, board members, and everyone, really, all the staff, for sticking it out, because we only noticed this meeting until I think 7:30. So we are way over, but it was a very important discussion. Thank you, community members. Thank you, team. Thank you, Dr. Dixon. And so the last thing we need is just a motion to adjourn.
A motion that we adjourn.
Second.
Pierce.
However you want to do it.
Sorry, did I catch you off guard there?
Oh boy, it went. That was about the fastest the 7 of you moved all night long. We'll credit Dr. Pierce with the motion and Board Member Brown with the second. And if you're ready for the roll call, Ms. Beckerly.
Yes.
Mr. Brown.
Yes.
Mr. Cole.
Michael.
Oh, I'm sorry. Yes.
Okay.
Thought you would stick around a little bit.
Dr. Pierce.
Yes.
Mr. Ragland.
Yes.
And Vice President Reyes.
Yes.
And President Adair.
Yes.
Okay, that's all of you. Very good. Motion carried.
All right, get to practicing and singing and playing music, students. We can't wait. Good night, everyone.
Thank you all. Good night.
Good night, everyone.